We'll get that taken care of.
You are captured. Go ahead and fire away.
Um, I'm sorry, if the box showed up, I missed it.
Okay, let me go ahead and reassign it.
Okay, thanks.
Kimberly, I can hear you. Is there something I can help you with?
Yeah, I need to be made capture again, please. I had to leave the meeting. Thank you. Thank you.
Good morning, Pima family. We're coming to you live from 4905. Welcome to this year's Virtual All College Day. I'm Greg Wilson, Dean of Applied Technology, and your host for this year's event. As much as we wanted to get together in person, it was important for us to keep everyone safe and healthy. So here we are, together in a virtual setting, our new normal. How many times have you heard that phrase over the last 5 months? Before we proceed, we want to acknowledge and be mindful of the fact that we are on the ancestral lands of the Pasquayaqui tribe and the Tohono O'odham Nation. We would also like to take a minute to thank College Events, PCC TV, IT, and our interpreters for making today possible. Today we will hear from 4 outstanding speakers that will provide important information reflecting this year's theme, Reimagining the Future. Our morning activities will conclude around 11:30 a.m., and everybody that watches the program in its entirety this morning will be entered to win a $200 Amazon gift card sponsored by Pima Foundation. Thank you, Marcy. Unfortunately, Carlos, we are not delivering donuts this morning, so we encourage you to pour another cup of coffee, enjoy your breakfast, sit back, and enjoy the show. But keep your thinking caps on. I bet your Pop-Tarts that today you will learn at least one word, concept, or initiative that's new.
On behalf of the Pima Community College Governing Board, I want to welcome you all back to a new school year and to All College Day 2020. 2020 has been like no year we've ever experienced. It's been heart-wrenching and complicated. It's been challenging and it's been hard. And I want to commend Chancellor Lambert and the entire Pima Community College family, each and every one of you, our faculty, our staff, our administrators, for overcoming extraordinary challenges and persevering through this unbelievable situation. All really focusing on our students. Thanks to you, our students will be able to enjoy a new school year in which they'll be safe, they'll be supported, and they'll be inspired to learn. So they can pursue their dreams, not just today, not just tomorrow, but really for the rest of their lives, and build an equitable society. I want to recognize College Events and PCC TV for creating what promises to be a fascinating and interesting day to hear new ideas and reconnect with old colleagues. Again, thank you for making Pima a premier community college, not just in our region, not just in our state, but in this country. I wish you the best for a new school year, and I look forward to being together with you soon.
Hello, I'm Marcy Euler, President of Pima Foundation. It is my pleasure to speak with and thank you for supporting the efforts of the Foundation. For over 40 years, the Foundation has developed and managed funds for programs, endowments, and scholarships for the college and its students. Our team is proud of our partnership with Pima Community College.
We host your alumni community, and we assist the college, its departments, and programs with fundraising events. What I'm most excited to share with you today is our new branding and vision. You can always refer to us as the Pima Community College Foundation, but as we focus on our internet presence and digital footprint, we see the importance of contemporizing our name, introducing Pima Foundation. Our purpose remains steadfast. The vision and mission guide our work. We have a new website as well. Plus, our team is developing a library of collateral, a resource portal for our alumni community, and a fresh blog focusing on the people and enterprises that keep the foundation thriving.
As a PCC employee, you can give automatically through My Pima payroll deductions. Here's how.
Thank you for your generosity toward the PIMA Foundation. We are grateful for your support and for your help in keeping our students thriving.
Thank you, Damien, and thank you, Marcy. COVID-19 has forced us to work harder and put in longer hours while taking care of our families and chores around the house. But it's also given us the opportunity to start a project or hobby that may have been on the back burner for a while. Let's take a look at what some of us have been up to this summer. How about that? Happy birthday, Daniel, and our automotive building is going up, looking good. At this time, it is my pleasure to introduce Dr. Jim Chang. Jim Chang has been Arizona State demographer since 2012. He is responsible for overseeing the production of official population estimates and projections for the state of Arizona and its counties and incorporated places. Jim represents Arizona on the Federal State Cooperative for Population Estimates, and he works closely with the U.S. Census Bureau on its decennial census and annual population estimates programs. Welcome, Dr. Chang.
Dr. Chang, you're muted. Dr. Chang, I apologize. We are still not getting any audio on our side.
Please hold tight. We're working on it. Can't hear him? Okay. Just move to the next video. I can't see what's going on. I just see,
Hello, can you hear me now?
There we go. Yes, I
Okay,
can hear you.
good. What happened was I called in on the phone, and it looks like this the phone and my computer, they're not associated together. Okay, good, great, thank you. We'll get started. Sorry about that.
We're not going to be able to see his stuff there.
Again, my name is Jim Chang, state demographer with the Arizona Office of Economic Opportunity. Today, we will be discussing demographic trends in Pima County and college enrollment. Let's get right into this. These are population pyramids. There is no better tool than a population pyramid when you want to have an overall understanding of a population. Here on the left, we have the Arizona population the pyramid. On the right is Pima County. Let's go right into Pima County on the right. So this is how you read it. This tells you the age and the sex structure of a population. So on the left, that's the male population. On the right, that's the female population. And if you go from bottom to the top, that's from age 0 all the way to, you can see 84. The top one is not a single age, is age group 85 and above. That's why you have this long bar on the top. And in addition to the traditional age and the sex structure, we added another element. That's the Hispanic origin. In the center of the pyramid, you see the warm colors, the pink and brown. That's the Hispanic population. Again, male on the right, female on the, male on the left, female on the right. And on the outside of the pyramid, the blue colors, that's the non-Hispanic population. You can see we have a good proportion of Hispanics throughout all the ages. Of course, the younger ages, we have more. And there is another thing that's if you look at the age 18 to around 24, you see a kind of a bulge. That's because we have a pretty big university in town, University of Arizona. Yes.
I apologize for interrupting you. We are actually not seeing your presentation.
You're not? Oh. Okay. Let me pause. And sorry. Do you see it now?
Yes, sir. We are seeing your presentation now.
Okay. Okay. You heard me. So this is the population pyramids that we were talking about. Again, on the right, that's the Pima population. I've been describing this pyramid. So we're looking at the pyramid to the right. That's the Pima County population pyramid. And the bulge around age 18 to 24, that's the college population. And if you go up to the age around 55 to 72, that looks like we have a pretty good presence of the retirement population, okay? And again, I described the Hispanic population, that's the warm colors in the middle, and the non-Hispanic population, that's the blue color on the outside. Let's move on to the next graph. Again, that's Arizona and Pima County. Let's go into Pima County right away. This is from the same data, just to look at it differently. We removed the numbers. We're just looking at the proportion of the Hispanic population and the non-Hispanic population in our population. As you can see, the best way is probably to read it from the right. The very old age, 70, 75 and above, you can see our Hispanic proportion is about 15%. And as the age goes down, that proportion goes up dramatically. And when it goes to 45, it stabilizes for a while. And then around age 20, there is a big spike, and the two line actually crosses, and Hispanic population is more than half of our population. Okay, this information is taken from a report of the Pima Community College student characteristics. First of all, we look at the head count by gender. We can see male population is male student population is 42%, female is 56%. Hold your thought for a while. We're going to come back to this. Just remember, well, you probably know this. We have a 14 percentage point difference between female and male. And in the general population, of course, the male and female population is roughly 50-50. And the next one is the head count by age group. Clearly age group 18 to 24, that's the largest age group we have. I will use that later as well. And this one, this is race ethnicity. I decided to compare what's the composition on campus, and what's the composition in the general population, and what's the composition of race ethnicity in our K-12 public schools. So two big groups jump out immediately. That's the Hispanic / Latino and the white non-Hispanic. The blue column, that's the Pima Community College proportion. You can see Hispanics 47%, non-Hispanic 37%. The orange bar, that's my office's estimate for the population of age 18 to 24. The reason I use this age group is because, as we saw, that's the largest age group in Pima Community College. And interesting to see that the Hispanic population and the non-Hispanic population, the proportion is actually almost exactly the same this year. We'll get to this again later. But if you look at the public schools, the K-12 public school, the Hispanic population has exceeded the non-Hispanic population by quite a large margin, 54 to 32. Since Hispanic population is such a large proportion of our campus, it will be fair to ask the question, what do we see as the trend going forward? This presents our population estimates and projections. It goes from 2010 to 2040. Of course, anything beyond 2020, that's our projections. So again, let's focus our attention on the Hispanic population and then the white non-Hispanic. The Hispanic is the brown line. Again, we're looking at the Pima chart to the right. So starting from 2010, Hispanic population, we're talking about age 18 to 24, because that's the largest age group on campus. So that was below 40%, about 39. And in the white and Hispanic population was about 47, 48. And Hispanic goes up, white and Hispanic goes down, and it was pretty steady. As we saw on the last slide, this is the year when the two crosses. Okay, Hispanic population just surpassed the non-Hispanic population. We're talking about age 18 to 24. And going forward, this trend will continue. But interestingly, in our projection, this growth will slow down. And at some point, in about 10 years, it actually will stabilize and dip a little bit. You might ask, why is that? And let's get to the reason why we are projecting this way. Before we do that, let's just take a look at another age group. That's age 0 to 17. That's the upcoming age group. That's the people who will be coming in the next 10 years or, to 20 years. So their proportion, it was already above 50% back in 2010, and it was going up again, and not dramatically. It's just from around 51, 52 to about 55 over a 30-year period. I would not call it a dramatic increase. It's a slow, the same trend, but pretty slow. Okay, again, why are we projecting this way? This is the Arizona total fertility rates. I don't have this broken down by county, but the county numbers are not too different. A total fertility rate is the number of children a woman would have if she goes through her her childbearing ages, experiencing the current fertility situation. So it measures the fertility situation for a period, usually a year. So in here, we start with 1990, and we go to this year. This year is preliminary data, but I just got it a couple of days ago, and I was able to put it in here. But anyway, if you look at throughout the 1990s and much of the 2000s, the Hispanic population, Hispanic TFR, total fertility rate, that's on the top, just fluctuated around 3. So the high was 3.1, the low was 2.9, 2.8, 2.9, but it's, it was pretty stable in there until something happened in 2007, 2008. It kind of peaked in 2007 and it started declining in 2008. And it just goes down dramatically. And in a span of 5 years, it went from more than 3 to around 2. And the same trend happened to the non-Hispanic population, but not anywhere near as dramatic as the Hispanic change, the change in Hispanic fertility, total fertility rate. And after 2012 until 2015, it kind of stabilized at the 2.0, 2.2 mark. And then after 2015, the decline continued. You'll notice that throughout much of this graph, the difference between the Hispanic births and the non-Hispanic birth, it was about 1, right? It's a whole baby we're talking about. And then after 2011 to 2012, the difference narrowed dramatically to 0.1 to 0.2. So we're talking about a tenth or 2/10 of a baby. So that's why the slowdown in the Hispanic growth, because the difference is just not there anymore. Well, we still have the difference, but it's about 1/10 to 2/10 of what it used to be. And again, I just a cutout of the previous graph. This is from 2004 to 2020. I cannot help but compare that to this one. It's that right. It was dizzying. As a practicing demographer during this period, it was exciting to live through a period like this and observing it real time. And this has real implications. And, that was the rate. This is the actual birth. And while we're talking about birth, I thought I'll throw in death and take a look at the natural change. Again, we have Arizona graph and the Pima graph. Let's look at the Pima graph. So this starts back in 1960. So throughout much of this, you can see birth is the green line on top. It was going down. And death was, the birth was going up. Death was also going up. But for most of the time, birth was going up faster than death was going up. So the result was the natural growth. Natural growth, remember, is simply the difference between birth and death. So the blue line is the natural change. The natural change was going up until 1990s, and then it was kind of stabilized, and then went up again until 2007, and it peaked in 2007. And from there, as we saw, birth went down fast, but deaths just kept going up relentlessly. So that brought our natural change downhill. So in 2007, just from the difference between birth and death, we had a growth of population of 6,000, more than 6,000. And that number today, well, not today, last year, 2019, was just a few hundred, like 400. We have some preliminary numbers for 2020. I did not put them on here, but I'm sorry to break the news that this year, the natural growth is no more growth. It becomes natural decline. We are firmly in the negative territory. If I had a graph to 2020 in here, that line would dip below the zero mark. And the red line, the deaths, would have crossed the birth and higher than birth. And we're going to have more than this year.
This meeting is being recorded.
Okay. Now back to the community college, Pima Community College, and the Pima County population estimate. Again, we're looking at population 18 to 24. The Pima Community College data is presented in the green line. The scale is to the right. As you can see, for the last 5 years, we experienced some steady decline, while the population of 18 to 24 was growing. So I'm in no way saying that the population, the general population and the head count, they are negatively, they have the general population has a negative impact on enrollment. That's not what I'm saying. But I think it's fair to say, if we are seeing a decline while the population is growing, what happens if the population starts to decline? It might be more difficult for us to grow our enrollment. So obviously, enrollment is not, in fact, is influenced by a lot more factors than just the population. I'm going to leave that to you, and you're more of an expert on this to figure out what other factors are, but I'm just presenting here the population and the head count. So in terms of the general population size, I think for the last 5 years, the college was having a tailwind. Even with the tailwind, we have declined. And, you might want to ask, are we going to have this tailwind for a long time, forever, and will things change? Well, this is what we see. This is our estimates and projections for the for the 18 to 24 population. And as you can see, this population has been growing. The red solid line, that's the estimate. And starting this year, starting 2020, that's our projections. So we project that this will go up for another decade. And it will then kind of plateau for 3-4 years. And they actually will start declining in about 10 years from now, 2030, 2031. So I don't know if you plan that far ahead, but I think, this is something that probably is good to know. Now, before we end, I want to throw this to you. This goes to why we are in this business. This is education attainment. We are actually going to compare education attainment in the United States, in Arizona, and in Pima County. Forgive me for using this particular measure, which is the percent of the population with bachelor's degree or higher by age group. I know Pima Community College is not in the business of granting bachelor's degrees, but this is the measure where we have good data, where we can break it down. And I also know that even though you don't directly grant bachelor's degrees, I'm sure what you do contribute to this measure. A lot of your students do transfer to four-year colleges. So let's look at this. So this is the measure for population 25 years and over. So when we measure population, the education attainment of a population, we usually look at the population of 25 years and over, because that's, you give them the chance to finish their education. On the left, that's the universe of the population, and that's 25 and over. And to the right, that's broken down by age group. So that's why I'm not connecting to the very left, because that's the total population. So let's look at the age groups. The first thing you might notice is that I arranged the age groups kind of backwards. I put 65 and over, the oldest age group, to the left, and going down to the right is the younger age group. And I think you'll see why I'm doing that. So let's look at the United States. So age 65 and over, we're talking about 27% of them have bachelor's degrees or higher. And then we will go to the younger, the next age group, 45 to 64. That's 31%. And then we'll go down the age group again. That's 35%. 35 to 44 years old. We're looking at 35 to 36%. And then there is a slight dip to the next age group. So you can see when we arrange the age this way, you can see a trend that's going from the older generation to the younger generation. For the United States, the trend is generally welcome, right? It's the younger generation is better educated, except for the 25 to 34. That's a slight dip. I think we could do better, but you could also argue that in this age group, a lot of people are still, nowadays people can go to university almost continuously. So there's a chance for them to catch up. But anyway, the general trend is good. Then let's look at Arizona. That's the gray line. It's almost a flat line, and then there is a substantial dip. So we can say it's not doing great, but that's Arizona. And then let's look at Pima County. We start off really good. For people 65 and over, we are at 35. It's better than anybody on this chart. And it drops pretty quickly to about a 31 for ages 45 to 64. And then it's a flat line, and then it dips again, and a very substantial dip. I think you would agree that this line graph would look better if it was going the other way, if it was going up, right, like the U.S. So I think all of us have work to do to improve this. You probably know why we have a good educated population for 65 and over. That's probably the people who retire and move here. Those are the people who have the resources to move and who are probably in good paying jobs before they retire, and they were better educated. So, and that's one of the reasons. But definitely for 25 and 34 years old, we need to do better. Well, this is the population not broken down by gender. I want to go one step further and introduce this one other dimension, which is gender. When you introduce one more dimension, that doubles the data points. And when you have too many data points, the chart becomes very busy, very difficult to read. So I decided I'm going to remove Arizona from the chart and just look at the US and the Pima, and we have male and female for each. So Arizona is out of the picture on this chart. Again, on the left, that's the universe. And we have 4 categories. We have US male, US female, Pima male, and Pima female. And you might want to ask, what happened? Why do you have only 2 circles on the left? Well, that's because 3 of them, they are right on top of each other. They're exactly the same. Even the one that's a little different, it's not much different. In other words, if you just look at the average, the US male, US female, Pima male, Pima female, they're all doing about the same. Like 31% of them, 31 to 32% of them have bachelor's degrees or higher. That masks the difference by age. Now let's get into the attainment by age and by age group and the gender. Let's start by looking at the best looking trend. That's the US female, the light blue. So that starts at about 22 for age 65 and over, and we can agree that that's not a great attainment. And for that generation, that was the reality. And then it goes up very quickly, and then keeps going up, and then it kind of flat lines. So the US female line, I would argue, is a very encouraging, beautiful trend, right? And then looking at the US male, it's pretty much a flat line. That's the blue, the dark blue. And if you look at Pima female, it started age 65, it starts at about 29, 30, about 30. It goes up, not dramatically, but it was an uptrend. And it goes up again. There was a slight dip. That's kind of okay. But if we look at the Pima County male, that drop, it starts at above 40. So our older men, their education is better than anybody. It's great. But when you talk about the next generation, it goes down very fast. It just keeps going down. So the message I wanted to convey here is, while we want to celebrate the achievement of our women, remember on our campus, we have about 56% female and 42% male, a difference of 14%. So we want to celebrate the achievement of our young women. But this graph seems to me kind of screams help from our young men. I think I will leave it to you to ponder over this. And I don't know if you want to, entertain questions at this point, or leave the questions just to future communication. This is my contact information if anyone wants to write this down and contact me anytime. Thank you very much.
Thank you, Dr. Chang, for shaking off the technical difficulties and presenting great information. And to the 1,000 of you out there, thank you for keeping your thinking caps on and generating a great discussion in the chat. At this time, we're going to share another video.
I have taken up gardening. When I started this venture, I didn't think about bugs. I hate bugs. I had 2 caterpillars that completely destroyed a tomato plant in like 2 days, but that's been the most challenging part. I planted some peas, beets, carrots, a watermelon. My squash are out of control. Sweet potatoes grow in like a week. They grow so fast. I also just planted pumpkin seeds because I want to have a pumpkin patch before Halloween. My son loves pumpkin patches. It's been a fun experience.
Congratulations, Karina. Well, there you have it. So if that pumpkin patch across the street from District doesn't open, you know where to go. At this time, it is my privilege to introduce Dr. Nancy Johnson. Nancy is a registered nurse and the Chief Executive Officer for El Rio Community Health Center, one of the largest federally qualified health centers in the country. Nancy serves as an adjunct clinical professor for the University of Arizona College of Medicine. She has also authored a textbook with her husband entitled The Care of Uninsured in America, and most recently an article in Nursing Administration Quarterly on healthcare for the homeless. Welcome, Dr. Johnson.
Dr. Johnson, your camera is currently turned off. If you would turn it on, please.
I am getting ready here. Thank you. I'm going to work on sharing my screen. Hopefully we won't have any technical difficulties here.
We see your screen.
Can you see my screen? Okay, let me get over here where we're going to try to get to start at the beginning. Whoops. Here we go. Maybe. Are you getting it? I'm not seeing it.
It looks like you unshared your screen.
Yeah, I did. Yeah. Okay. Well, I'm just so taken by the fact that the U.S. female population looked so beautiful on Dr. Chang's, Aaron, we'll try to share it here again. There you go. Are we sharing?
Yes, ma'am.
Yeah, I'm trying to get to, can you give me a little bit of advice here on how to get my slideshow started here? Because I see that you're seeing my whole screen.
Yes, if you go to the slideshow tab, you should be able to click that from the
there I
beginning
am.
button.
Yeah, let's go to beginning, huh? All right, we are ready to go now. Good morning, everybody. I'm delighted and I'm honored to be invited today to be with all of you, and wanted to just, first of all, just thank you all for the incredible work during the pandemic, hopefully once in a lifetime pandemic for us, and everything you're doing to just take care of our school community and all the students that choose Pima Community College. So I wanted to also tell you that this week is National Health Center Week across the country. And many of you may know or may not know that El Rio Health was founded 50 years ago with one of the original grants from the Lyndon Johnson administration, War on Poverty, in passing Public Health Act 330. So we started off as a little tiny health center that was founded with the University of Arizona College of Medicine and a group of activists who were really upset with the city and the county about I-10 being built, about their neighborhoods being disrupted, and about the creation of the Tucson Convention Center. So that's the rich history we come from. And today, El Rio is the 20th largest health center across the nation. And I think it's important to honor this movement of health centers that take care of nearly 30 million Americans across the country, with about 1,500 health centers. So we're really proud to have that heritage, and I'm really honored to be part of the Tucson community. So I wanted to give you just a little organizational overview of who we are. And it was really interesting looking at Dr. Chang's slides on the demographics and looking at the population we serve here at El Rio. As you can see, we serve over 113,000 unique people. Our race and ethnicity breakdown is very similar to the Tucson community. And we see about 500,000 visits. We have about 1,500 employees. And we're super proud that probably over half of our employees are graduates of Pima Community College. So you're a very important part of our workforce development for our employee base. Our employee, I always like to tell people we have such a young workforce. The average age of our employees is 32 years old. Many of our employees are bicultural and bring such gifts to the workplace in caring for others. So employees, provider employees, we have more than 240 employees that are providers. And in that model of care that's unique to community health centers that we've had time to cultivate over the past 50 years is a fully integrated model of care. So not only do people get their primary care health here, whether it's pediatrics, family medicine, or internal medicine, they also get their dental care here. They also get behavioral health care here, whether it's counseling for the general population or whether it's care for the seriously mentally ill. We have psychiatric nurse practitioners, psychiatrists, therapists, all embedded into our model of care. Our model of care also includes a diagnostic laboratory, general radiology, ultrasound, screening mammography, and we have our own pharmacies. So a lot of that has grown up, obviously, over the years to present a really one-stop shopping experience for our patients, that they have one medical health record that's available at any of our locations. And we really believe it's a stronger primary care model to keep people healthy and safe in getting their care and to avoid unnecessary hospitalizations. The other point I'll point out before I move on to the next slide is that our payer mix, about 52% of our patients are on Medicaid, and probably about 40% of that 52% live at 100% or below the federal poverty level. So we do take care of the most vulnerable and fragile folks in our community. We've also seen a growth in our private insurance, people who have Blue Cross Blue Shield, Cigna, Aetna, and I think it's because of the convenience factor and the ability to get care on Saturdays, early in the morning and in the evening. As you all know, the Affordable Care Act was passed in 2012, and I think it's noteworthy to see that our uninsured number of patients, percentage of patients in 2019 was 14%. Prior to the passage of that historic legislation, our uninsured patient population was 30%. So you can see the power of that legislation and the expansion of Medicaid in the state of Arizona, which has helped our state in access to care for various populations, also is helping us right now as we get to the topic of the current pandemic. Medicare population continues to grow a little bit every year. I just think it's the tsunami of people hitting age 65, kind of a natural growth there. As an organization, you can see the size in terms of our revenue and our expense. And part of our federal law that guides us from Public Health Act 330 is that we are governed by a community board. And 51% of our board must be patients of the health center, so they can weigh in and provide that free market research every month at our board meetings. But they also expect the board to be the fiduciaries and the fiscally responsible people for our health center. So you will always see that our operating margin is going to be a positive number. Now, this year with the pandemic, as I'm going to share with you, we aren't going to make that projected operating margin of 6% unless something miraculous happens in this last quarter of the year. But just a little bit about our organization that I thought you might find interesting. So let's talk about this pandemic and what happened to us. So all of a sudden in the middle of March, the first thing we saw was a 50% decrease in face-to-face visits by the middle of March. So just to give you a rough number, and it's really a rough estimate, during a month, just in medical visits, we will probably have about 25,000 patient encounters in a month. And, that's our run rate. We're staffed, we're ready to take care of those patients. And all of a sudden in the middle of March, we saw that 50% decrease in those face-to-face visits as soon as the public health emergency was noted and the attention focused on the pandemic. And what else happened? Well, obviously, as you know, we saw in the community the increase in the unemployment. We started seeing some people lose healthcare benefits. Just last month alone, in the month of July, our team here at El Rio helped 903 individuals with either applying for state Medicaid because of loss of health care or, applying through the marketplace for insurance that they may qualify for with some subsidies. So we saw all that happen in our community, and we saw a lot of obstacles for patients to obtain care. Our call center, as a general rule, has about 50 employees, and they take about 70,000 calls a month. They were up to about 76,000 calls that month of April, with just patients calling in, worried about, shall I come in for my care, or how am I going to get my medications? Is it safe? All kind of worries. Should I go to the emergency room? I'm having these symptoms. We run a 24/7 nurse telephone care line, and those were the types of things that were happening within our community starting towards the end of March. Also just effects around the quality of care. We measure, I always tease that we measure everything from appetizers to dessert here, and we have huge dashboards of data we collect around patient utilization, but in this circumstance, looking at our quality of care measures. Not only did we see a decrease in encounters of visits with our patients, but we also saw some of our metrics around pediatric care starting to drop. More children that were missing well visits, more children that were not getting those important disease preventable immunizations. So, that's very worrisome in that immunizations are our primary prevention and our first line of defense. And, brings up a good point that where we sit as health centers, we are the front line. We are the folks that are trying to keep everybody as healthy and tuned up as possible to protect the hospitals, particularly during a pandemic. So the fact that we might have patients who weren't getting their chronic care management, whether it was around their diabetes, their heart disease, whether they weren't getting those important screenings, particularly if we pull out thinking about cancer screenings, colorectal cancer screenings, breast cancer screenings, all have a long-term impact on the health of our community. So where we sit, as I mentioned in that primary prevention piece, that's all the immunizations we do with our patients. It's the health education, the health promotion, everything we do around maternal child health to keep populations healthy, especially at early part of the lifespan. Screenings are what we call our secondary prevention services, where we try to identify early if people are at risk, if they have an abnormal screening test to prevent long-term cost and quality of care. Health centers, just to give you a number, health centers across the nation are thought to save about $124 billion in healthcare costs annually by keeping people healthy, as I've described. Also, what happened, our workforce was very anxious and concerned. One, as little information was originally available to us, they were worried about whether they were safe coming to work. And they were also worried about, am I going to have a job? You know, we see that our patients are staying home with a stay-at-home order. Am I going to have a job? And so I'll talk a little bit more about some of the things we've done with our workforce in that we've been able to keep everybody employed who desired to stay employed through the pandemic. Initially, we had some difficulty in obtaining our PPE, in getting enough masks and gowns and shields for everybody and gloves. But now, I'm really pleased to say that our distribution channels are stable and everybody has plenty of PPE here, which we measure on a weekly basis. We elected to close 4 of our smaller health centers to bring our workforce together and to be able to be more efficient during this time of pandemic. We also had surveyed all our employees and were able to identify employees who were at risk, who most likely should be home or should be working at home. And lastly, you know, the rapidly changing public health guidelines. A lot of our patients calling in then and still continuing to call in are asking questions because the social media feed, what they see on the news, what the public health department puts out, all different sources of information that cause people to have some angst about that. So what we did, we activated our incident command structure. And, you know, from a leadership perspective, we have always drilled around emergency preparedness and participated in community drills. And this is where we really saw the benefit of that. Our incident command structure continues to be up as we enter, I think this is our 6th month of addressing the pandemic. And we are a well-oiled machine in terms of how we adjust workflows, how we address the environment, how we handle risk with our patient population. In addition to that, in setting up our command structure, we coordinated with the City of Tucson and Pima County Health Department and also our hospitals in checking in with them, in having connections to allow them to triage people to us that really didn't need hospital care or acute care, and also to help meet the initial demand when we were seeing clusters of COVID outbreaks across the community. Many of you probably remember hearing about some of those back in April in some of the congregate living facilities, some of the skilled facilities. And what we were able to do was take some of our workforce and send them out to go door to door in those apartment complexes, working with the skilled nursing homes to test all those individuals and try to separate the healthy from the healthy non-exposed from the symptomatic and those that were actively ill. In addition to that, we deployed some of our workforce to work in the hotels in town. The City of Tucson contracted with 3 different hotels initially. I think they have 4 now. And we provide the nursing care and the medical oversight to test those populations, screen those populations, determine when they can be discharged and move to a well facility or permanent housing in some way. So we've been heavily involved in the care of the homeless in the community as well. We wanted to keep our workforce working, as I mentioned, so we also have been doing work for some employers. For example, every morning at 4 a.m., maybe some of you are out, but we have a team of El Rio's clinical staff who are out at Tucson Electric Power screening the workforce at the start of each shift, finding anybody who's symptomatic, who may have been exposed, and then facilitating the testing and the follow-up contact tracing with those employees. So we've been able to keep everybody employed through, the flexibility and resiliency of people who work in healthcare. To me, is always pretty amazing. And we also had an opportunity to look at some of the fragmentation of our data, in that we had analytics coming from our IT team, we had analytics coming from finance, we had our quality team bringing information. And now what we've created in our organization is a centralized data analytics team that all works together. We moved some FTEs and people around, so they're all able to present a daily picture to us, a daily dashboard of what's going on in our organization, looking at face-to-face care, looking at telehealth, all those sort of things. So before I talk about the financial implications of the pandemic, let me pause a moment to talk about deploying workforce home. So within 2 weeks, we were able to move, as I mentioned, we have about 1,500 employees. We were able to move all of our non-clinical folks to work from home, accountants, business office, call center people. Many of our triage nurses already work from home, but we got all that done in a couple weeks. And then we also brought up our telehealth platform in 2 weeks. We have had telehealth, and we just kind of had our toes in the shallow end of the pool on telehealth. And with a public health emergency, we just bumped that telehealth up. And it's been phenomenal to see how quickly patients of all ages, all areas of the community have taken to telehealth. And that now to the point, if they're on an audio and visual telehealth visit, like we're talking today, after the visit, they get a link to complete a survey. So we're getting that ongoing data about how they felt comfortable with it. They felt like their needs were addressed. And because we're in the middle of a public health emergency, we're still able to do audio visits with people who don't have that access to technology. Budget changes, this is always a pandemic, or any kind of event like this is always a great time to look at operational efficiency. How can we deliver care in a more cost-effective, efficient way for our patients while still maintaining those quality metrics that I've mentioned, as well as an excellent experience for our patients? So great opportunity for us to learn and continue to improve our care for the community. So where are we today? One is we have completed nearly 22,000 tests. These are the viral PCR tests that our team has done for the community. As I mentioned, some of it has been through outreach. Some of it has been through drive-through testing at all of our sites. And this is about 12% of the community's testing. So now that our public health department is up and operational, we're starting to see our testing go down, but we continue to offer that for all community plus our patients. We were really fortunate in that the legislators, as part of the CARES Act, health centers received funding to help with that telehealth uplift I told you about, but also to give us money for testing. So there are no barriers to testing people in terms of insurance or needing any funds. It's all funded by those grant dollars. Interestingly enough, where we are today, our current care capacity, number of patients we see, we're running around 90% of our pre-pandemic run rate, and about 35% of that is telehealth. So as the public health emergency was extended for another 3 months, we still have some patients that are doing audio, just audio as I mentioned, but more and more of them are coming on to a full audio visual visit. We've also been fortunate, we had some donor dollars from some of our contributors into the El Rio Foundation that have allowed us to have funds to help some of those patients. One of the things that we have always known, and we've always screened our patients around the social determinants of health, their educational level, housing insecurity, food insecurity, employment. Are they in a area where they feel at risk for their safety? Just all those factors that we know are the root cause of people being able to really optimize not only their health status, but their quality of life. And we collect all that data on our patients, but what we saw within this pandemic was really an exacerbation of those challenges. So that now that, some people don't have employment, right, because of the pandemic, and they don't have access to healthcare, we really have seen a lot more needs presented. So our partnerships with the food bank, with the housing folks through city and county, all those have helped us, help our populations and our patients maintain during this difficult time. We also, as a result, all of our health centers are a little bit different, just like everywhere we go, in that we're fortunate that we have all the protective equipment we need for our employees and for our patients, but we've also increased the cleaning and the sanitation. We've gone to a touchless system in terms of kiosks with our patients. We've also spread out appointments. We're fortunate to have large facilities that allow us to physical distance people. So our tracer teams are out in those clinics just checking to assure that we are providing our patients and our employees with a really safe experience. And I tell all the employees, I feel safer during a pandemic in any of our health centers than I do many other places in the community. But our team has been amazing and really dedicated and passionate about the work they're doing. We continue to do screenings and testings for various employers in town, and that has helped us keep our employees working. So we appreciate that community support. And, probably a week from now, we'll get our first inventory of flu vaccine. So we'll get all of our employees vaccinated, probably, I'm hoping, by Labor Day. And then we're also going to combine that drive-through testing with drive-through flu vaccines, and also doing a lot of workplace flu vaccine immunizations. We all know how critically important the flu vaccine is this year for our community and our population to keep people as healthy as possible. So this is kind of where we have started reimagining healthcare. As I mentioned, we've been looking at all ways that we can be more efficient. We've also, as I mentioned, introduced the touchless kiosks for our patients that sitting here at my computer or with my iPad or with my phone, I can easily go on there, put in all my health information, my medical history, do that assessment around social determinants of health, and check myself in. And we're almost to the point in using geofencing where our team here will know that that patient is checked in. They won't even need to alert us when they walk in the door. So, that's a very safe practice, not only from a pandemic infectious disease management point of view, but also just from an efficiency, cost of care point of view. We're just about to get started after Labor Day on a Care Can't Wait campaign. As I mentioned earlier, we continue to be very worried about children falling behind on their immunizations and their well visits, in that those, disease preventable vaccines are very, very important, as well as the well child visits to ascertain if there are any delays before children reach 5. We've got text messages going out to our patients who need to have their annual colorectal cancer screening or need to have their mammograms done or their A1Cs for their diabetes around chronic care management. So we've been doing a lot of the texting to our patients. We also are looking at what is the long-term strategy for telehealth. As a nurse, I have anxiety about telehealth being a cold call, in that we've been putting our protocol together that telehealth are for patients who are established patients, and that I think the important part of safe telehealth is that whoever you're having a telehealth visit with can look at your medical record, can see what your medicines are, knows who you are to determine if we need to see you again. And, the anxiety about rolling out telehealth just as a consumer product is that we'll miss something. When we do need to examine someone, abdominal pain is a great example. I heard recently about a patient with a telehealth visit that then ended up in the emergency room with diverticulitis. So there needs to be some guidelines around that. As I mentioned, the digital symptom checkers and also virtual health coaches through telehealth. We have registered dietitians that are doing a lot of work with some of our patients around their weight management, also checking in with our diabetics. We have taken all of our health and wellness and loaded it onto our YouTube so that a lot of our patients are doing their usual yoga, Tai Chi, Zumba, what have you, online now through our YouTube. And particularly, we have seen a lot of parents taking advantage of the classes that are up there for children. We have one family, I think they have taken every online cooking, every virtual cooking demonstration course that we have for parents and children. So trying to help in that way. I think that we've also seen the impact around behavioral health, in that many of our telehealth visits have been with a behavioral health patient population that we take care of. And as I mentioned, that population particularly is at risk around those social determinants of health, lacking permanent housing, good social support systems, frequently experiencing social isolation. So all kind of secondary consequences of the pandemic. One of the areas I missed on this slide, if you can bump your eyes up with me to the alignment around healthcare financing and reimbursement. Telehealth, because of a public health emergency, is funded currently through Medicaid, commercial insurance, and temporarily for Medicare. So that's temporary in terms of Medicare and some of those commercial insurance companies. So we're doing a lot of advocacy at the federal level around hopefully making that permanent, that Medicare and telehealth are reimbursed for providers. So telehealth becomes a big piece of that. Patient experience, as I mentioned, the patients seem to like telehealth, but we have many patients that I've identified. I really want to come in. I want to sit down face to face and talk to my doctor. Obviously, we had to close dental down. So we have, as we're reopening dental, we have lots of people desperate to have their teeth cleaned and to finish their dental treatment that may have been interrupted with the pandemic. And then, we also have continued to deliver medications. Our pharmacy has bumped up transportation to deliver medications, mail medications to our patients, just to be sure that, we're keeping people that have chronic conditions tuned up and away from expensive tertiary care in the form of hospitals or urgent care emergency room visits. As I mentioned, we continue to support our staff. The current that you're all, I'm sure, dealing with too, is that with so many of our staff having and raising young families, the school situation currently, with it not being safe to have the schools open, is causing a lot of disruption for our workforce. So as an organization, we've created a little fund where they can ask for financial help up to a limit around childcare or support with their children. And it seems to be people whose children are anywhere from 8 to 13 kind of clustering around this. And then we're also have made them aware of the City of Tucson grant funding that will open up next week to help parents with childcare being one of them, but other needs of families as well. Community partnerships, and as I mentioned before, we've put together really a strong centralized analytic team looking at data every day. So our dashboards every day, we're looking at our face-to-face visits, how many are telehealth, how do the visits break down across medical, dental, and behavioral health, how many food boxes have we delivered, what's our workflow like, what's the turnaround time on test results. So just information I'm sure you all may have been watching, but Operation Catapult, which our laboratories in the state of Arizona have taken on just in the last week, have that test turnaround time down to a nice 24 hours. That was an investment from the Arizona Department of Health Services, Sonora Cobb Laboratories, and others to bring more instrumentation in and get it online so that we could process testing much, much quicker. Our community partnerships continue to nurture us and continue to help us with our patients. There's not a day that goes by that we're not trying to facilitate either transportation, employment help. We have a medical legal partnership program that we fund here. So our paralegals have been helping people, with housing issues and things like that. So we couldn't do it alone without the support of our many community partners that help El Rio. And then lastly, just a piece around the advocacy. You know, House and Senate are both out of session until early September, but they still have legislation there that would once again provide additional funding for community health centers. As you know, we care for everyone that comes in the door, whether they have a penny or $1 million. Last year, we provided about $12 million in charity care for the community, and continue to do that with the help of many. I wanted to pull out just a couple slides to share with you all because you know, we're in the world of education here, and this article, you can pull up the article, but it came out the end of July from the New England Journal of Medicine. And it clearly illustrates the disparities that we're seeing with COVID. The severe outcomes from people who are of different racial, ethnic minorities that don't have access to healthy food, to housing, to shelter, to healthcare, to education. So all those risk factors that are kind of at the bottom of the diagram you see on your screen, plus knowing the population have a higher incidence of mental health disorders, chronic diseases, and really it's resulting in poorer outcomes if they test positive for COVID. So just a good article to read as we're thinking about the importance of education in changing things for various vulnerable populations in our community. It's probably one of the most powerful things we can do. And lastly, I mentioned social isolation earlier and how we take in our programs to our YouTube. And as you can see, these are moms and babies, right? And they are participating in a couple things. One is our postpartum support group. And you know, one of the real risks for new moms, particularly in a pandemic, is social isolation and postpartum depression. So we are hosting those groups for our families. We deliver about 2,000 babies a year. Once again, tying back to Dr. Chang's demographic presentation, we are seeing an increase in births this year, and I don't think we've seen any of the COVID babies yet. So that's kind of an interesting trend from our patient population. And then we also offer the baby love classes. And these are classes for moms, and you know, there's infants, there's crawlers in this class. But once again, it's building that virtual education and support for our patient population. And last but not least, we want to thank you all for your support. Many of you are faculty that enter our El Rio Health Centers. We're really proud of our academic affiliations with PIMA. And as you know, we employ many of them, and we see you as our pipeline for our future workforce. So we can be more happy to support you in any way we can, and welcome you all back to the fall all-campus school year. Thank you.
Wow, Dr. Johnson, that was a lot of information. Thank you for all you and your team at El Rio Health do for our community, not just fighting on the front lines during the pandemic, but what you do day in and day out to help heal our community.
Thank you.
Also, want to mention in the chat, please support our food pantry. Saw that was just mentioned. And at this time, we're going to share our summer video winner number 2. Congratulations, Annette, to you and your furry friends. You know, I know everyone's wondering where the TP went, but I think I'd give up a few roles for that. At this time, it is my honor to introduce Dr. David Hall. Dr. Hall has been president of the University of the Virgin Islands since August 2009. Prior to joining UVI, Dr. Hall served as provost and senior vice president of Northeastern University and previously as dean of the Northeastern University School of Law. He has been honored by the Massachusetts Black Lawyers Association as a trailblazer and was appointed by President George W. Bush to serve on the Legal Services Corporation Board of Directors. His publications include works on civil rights, the U.S. Constitution and race, legal education, and social justice. He has authored a book on the intersection of law and spirituality and lectures nationally on topics of social justice, leadership, ethics, diversity, and spiritual values in professional life. Welcome, Dr. Hall.
It is an honor to be invited to serve as one of your speakers for this All College Day event. I want to thank Dr. Mays IMAD for inviting me and Chancellor Lambert for his leadership of this premier college. Community colleges around this nation serve an essential role in our nation's higher educational mandate.
Dr. Hall?
Yes.
Just for a quick moment, we do not see you on camera. We just see a black screen.
Okay, I don't know why. The video is on. Is there something you may be able to do on your end? Because I don't get any symbols or indication that the video is off.
There is nothing that I can do on my end. We may just need to proceed without your video.
Sorry about that. If you want to
Are you physically blocking your camera? Maybe a sticky on your camera?
Dr. David Hall, let's go ahead and just proceed. We'll work in the background and see what we can do.
Okay. Can you hear me okay?
Yes, sir.
Okay. It is an honor to be invited to serve as one of your speakers for this All College Day event. I want to thank Dr. Mays IMAD for inviting me and Chancellor Lambert for his leadership of this premier college. Community colleges across this nation serve an essential role in our nation's higher education mandate, and Pima Community College is no exception. You are educating more students each year than some of the leading institutions in this nation. And more importantly, you are educating those whose educational choices are sometimes limited. You are educating geniuses who may have hurdles to overcome and fewer resources to address them. This is the noblest part of the educator's challenge, to extract from our students the genius, creativity, and enduring values that lie buried beneath the rubble of doubt, blankets of fear, and economic concrete barriers. When we can unleash latent talents, inspire novices to become experts, then our teaching is not in vain. And more importantly, we may have connected our educational heart with our souls. In the midst of this pandemic, during this period where cries of social justice have taken center stage as a result of the death of George Floyd, Breonna Taylor, and so many others, it is appropriate for educational communities to reflect on our role and our calling. So on this All College Day, as you launch one of the most challenging and hopefully meaningful academic years, I want to speak about the heart of social justice and the soul of education. Heart and soul are ambiguous and amorphous concepts that have a hard time finding their way into the intellectually and scientifically controlled domains in which many of us reside. As educators, we label these emotional and spiritual dimensions as being outside of our reach because of our inability to accurately measure and study them. Yet these elusive values are fundamental to our understanding of life, and I would argue fundamental to our understanding of our educational mandate. The soul of the education mission is the heart of social justice. Education is a process to enlighten, to help people better understand themselves and the world around them. Yet education does not exist in a moral vacuum. The enlightenment we attempt to usher into our classrooms and labs must relate to the environment in which the teacher and the learner exist. Otherwise, our exploration is artificial and meaningless. When the history we teach and the science we explore are laden with injustices, errors, and biases, then it is our task to point them out and address their consequences. Injustices embedded into the fabric of society are not just there to be studied, but to be corrected. Education, from my perspective, carries with it a moral imperative to usher in change. If my enlightenment does not change my behavior, then education is limited in its value. If my enlightenment only makes me fear and suppress the unknown, then I am not truly educated. I share these conclusionary statements knowing that there are those listening who already disagree, and that is appropriate. Education and the pursuit of truth are murky terrains because education gives people the license to ask fundamental questions like, whose truth? However, that question, which recognizes that we see the world differently, should not be a license to create our own set of facts. Otherwise, as enlightened people, we perpetuate the same sins and ills that education was created to address. Some argue that higher education has a liberal bias. I beg to differ. Higher education has an education bias, an enlightenment bias, a truth and factual bias, and those virtues cannot be suspended or diminished because of political dogma. The more people seek enlightenment, truth, and facts, and the more they are able to appreciate and embrace the need for social justice as we define it. If the educational process distort facts, distort truths and history, and never challenges our preconceived notions of people and life, then enlightenment will not occur and education has failed. Education also has a mandate to venture into areas not easily measured and assessed, but are worthy of our calling and mission. Not only are we responsible for helping to develop the minds of those we admit into our institutions, but I believe we are also responsible for their emotional and spiritual intelligence as well. This broader mandate, which has been subtly a part of the educational enterprise from its beginning, is critical to understanding the heart of social justice and the soul of education. If we only teach to the minds of our students, then we are limiting them and ourselves. We are placing education in a sanitized bubble, free of any contaminants of the world. Education is messy, and as educators, we must be willing to get our hands dirty and our hearts broken. It is out of that brokenness that we grow as educators and as students. We live in a nation where truth is painful because we have lied so long. Some are being asked to accept these generational falsehoods so others can live more comfortably with themselves and with this nation. Racial justice in America is not a marginal historical moment. It is the foundation upon which this nation was built and the contradictions to which it gave reverence. When a nation declares in its most sacred document that a significant part of its population is 3/5 of a person, and its highest court declares that a Black man has no rights which a white man is bound to respect, then wheels of injustice are set in motion that are hard to reverse. When this nation, through a civil war, attempted to come to grips with this horrendous institution called slavery, and finally resolve the contradictions in its most sacred document, that original momentum set in motion towards injustice, hatred, and denial raised its head again and created through laws and intimidation a system of segregation, oppression, and hatred that lasted for over a century. When Dr. Chang and countless others created a nonviolent revolution to save the soul of this nation and cleanse it from the sins of racial injustice, some responded affirmatively, some risked their lives to join him, while others resisted and built and erected Confederate monuments to tell the nation that the original sin was not a sin, but a way of life, a culture to be preserved. When this nation elected its first Black president, it was supposed to signal that the nation had reached a state that some called a post-racial America. Yet those same forces that had been set in motion centuries earlier never died, because they passed them on to their children, the falsehood, the hatreds and misconceptions, so that their children would say out loud, "Take my country back." So we find ourselves today in the throes of social upheaval in the midst of a pandemic where Black and brown people suffer and die from the coronavirus at a rate higher than anyone else. We are here because prior generations refused to resolve this contradiction, refused to fully repent from one of this nation's original sins, refused to fully change the underlying conditions that are the product and consequence of these contradictions and sins. And more importantly, refused to change the heart of this nation. Dr. Martin Luther King once eloquently captured this limitation when he stated, and I quote, "Morality cannot be legislated, but behavior can be regulated. Judicial decrees may not change the heart, but they can restrain the heartless. End of quote. Yet decades later, we find that the heartless figured out that they can change laws, circumvent policies, and suppress the right to vote so they can cling to power. Thus, this nation remains in this vicious whirlpool of denial and obfuscation. Until we can capture the heart of social justice and the heart of the nation, we will continue to go in circles, and so many people will suffer through the process. Our DACA students on campuses throughout this nation, including yours, are not only vulnerable because of the absence of laws, but because of an absence of a change in the heart of this nation. And though I have focused these remarks so far on racism and American law, which is my area of research, the same pattern that I have laid out can be seen in regards to gender, immigration, sexuality, and class. So the question is, what will we do? And more specifically, what will we as educators do? Chancellor Lee Lambert in 2015, in a statement issued by your college, captured the heart of social justice and the soul of education when he stated, and I quote, "We believe that the ultimate objective of diversity is the achievement of equality and social justice. Furthermore, social justice has no borders and is an essential right of the human race. Therefore, we recruit, retain, and develop the potential students and employees from historically marginalized groups in the US and from any region of the world, regardless of ethnicity, religion, disability, political views, gender, and other characteristics." End of quote. This is more than a statement on diversity. It is a vision about one important aspect of the intersection of education and social justice. This intersection demands more than diversity in hiring and recruitment. This intersection demands that as educators, we unabashedly pursue and cultivate the heart of social justice. I still must answer the question, though, what does social justice from the heart means? From my perspective, it means that we are trying to create not just educational opportunities for those who the society has marginalized, devalued, and feared, but we embrace a mandate to create a society where these students' dreams can be fulfilled, where their potential is exceeded, where no mine is wasted, no ounce of creativity squandered, and no badge of inferiority is ever affixed to anyone's self-worth. Social justice from the heart means that we are not just creating new policies and laws, but in the words of Dr. Chang, we are creating a beloved community. But that beloved community cannot occur if the price of admissions is to hold on to the myths of superiority and exceptionalism. That beloved community will never come into existence without changes in our organizations and changes in our hearts. Social justice from the heart means that we must have the individual and collective courage to stare in the face the horrendous history of injustice in this nation, understanding the consequences it created and investing in correcting them without rejecting everything else about this nation. Social justice from the heart means that we understand the fallacy of building monuments to men Whatever is worthy of their honor gets encased with their failings, contradictions, and even their evil. When we pay homage to one aspect of the person, we are inevitably paying homage to the other. Men and women are imperfect, and some are even filled with evil agendas. And therefore, we must pay homage to enduring values, not to men and women. Social justice from the heart means that we must build monuments to justice, monuments to love, statutes to the pursuit of truth, and plaques to honor mercy. We build those not with stones, but with daily sacrifices, with tears of personal growth and genuine generosity of spirit. Of course, we can honor those who contributed to our lives, institutions, and nation, but in the public arena, in the public square, this nation has forfeited the right to ask people to honor men who owned, brutalized, and subjected their ancestors. That would be the equivalent of demanding that a child born of an act of rape should honor the man who raped her mother or grandmother. The family of the rapist may be aware of his other noble qualities and may want to place flowers at his gravesite, but they should never demand or ask the child to honor him. The main goal of the family in regards to the child is to try to support her healing and her quest for wholeness. In the name of heritage and tradition, this nation cannot hold on to the symbols of its suppression of others. We cannot, in the name of social justice, hold on to the pattern and symbols that created the problems we are now trying to correct. As educators, we must study them, explore their nuances and ambiguities, but we cannot shield ourselves or our students from their role in creating a society with so many imperfections. Social justice from the heart means that we cannot inherit the psychological wealth of this nation without also inheriting its psychological liabilities. What this nation has chosen to do is to wrap itself in the glory of its past virtues and ignore or even erase the sins and crimes of its history. And when this horrendous history or its present manifestations are raised, the speaker, like myself, are labeled as not loving America. I should never be asked to love white supremacy, injustice, and the systemic marginalization of people. What I should be asked to love is an individual and collective good faith movement to correct these evils, not defend and rationalize them away. Those who can only be proud of this country by ignoring its shortcomings or rationalizing away its shortcomings are more vulnerable to the accusation of not loving America than those who criticize it. For they do not love the America that exists, but an America they have created in their minds by ignoring the past and present evils and shortcomings of this nation. They love an America that cherished Confederate generals who fought against this nation in order to uphold slavery, while they ignore and demonize non-violent protesters who are responsible for helping this country embrace many of its articulated values. As educators, we will never and should never view the world exactly the same. We should never expect or desire our students to articulate the same political viewpoint. Yet we must collectively embrace a commitment to facts and truth. How we interpret those facts is also where, as educators, we must strive for some sense of integrity and limitation. When social justice is in the heart, then we intuitively understand that the essence of education is to make this world a better place for all and not for a privileged few. When the government of the Virgin Islands passed a law in January 2019 that all Virgin Islanders, regardless of when they graduated from high school, would be entitled to free tuition for associate's and bachelor's degrees, This was a manifestation of the heart of social justice and the soul of education. For the last 2 fall semesters at UVI, we have seen a 29% and now a 25% increase in new students. This came about because of a government investing in its people, regardless of income and status in life. This was the government saying to those who had no interest or path that there is a path. And the soul of education requires us to broaden that path so more can walk down it. In conclusion, you may not embrace the vision I have shared with you today about the heart of social justice and the soul of education. And your understanding of social justice and the role of education might be different from mine. But if we honestly and soberly examine the history of this nation and its present conditions, I believe we would have to objectively conclude that something is missing from our economic system that permits so many people to end up on the sidelines of this nation, to be suffering from ills that existed long before the pandemic occurred. We would also see that higher education is still not accessible to all. We say that we live in a nation that is rooted in various religions, and some argue that we are a Christian nation, but yet the data does not demonstrate that we are. There is too much suffering, too much poverty, too much inequality to say that the principles of Christianity has taken root in our hearts and in the heart of this nation. As a great theologian, C.K. Chesterton once said, and I quote, "The Christian faith has not been tried and found wanting. It has been found difficult and left untried." For it speaks to the heart of social justice when the scripture asks of us, "What doth the Lord require of thee but to do justly, and to love mercy, and to walk humbly with thy God?" If we are offended by the concept of social justice, then we have to be offended by Christianity, because at its core, it is asking us to do justice, not just for one individual in one isolated case, but to do it for all who come to these shores and all who are here. The soul of education helps cultivate these values if we conduct it right and honorably. If we could clearly see social justice as central to our mission as educators, then I believe we will usher into existence a new world that serves and holds all of the people, all of the Adams and Eves. This is our calling. This is our collective destiny. So as you launch this academic year, I pray that collectively your community of educators will embrace not only the challenge of this moment in which we exist, but will embrace an underlying need to usher in a new reality. Thank you for giving me an opportunity to share with you. And thank you for being committed to using education to change the lives of so many. Thank you.
Thank you, Dr. Hall. Did you hear that? I don't know what you heard, but that was heart and love, right? We know not everything is right. And you can see in the chat, when you have a family of over 1,000 members, we're not all going to agree with each other. We're not all going to think the same way. We're not going to interpret things the same way, but we know things aren't right. We've got a moral imperative to change. That's what Dr. Hall just said. But it's not just about talk. As Katie and Brittany said, we've got to act. So keep that in mind as we start our semester and we start to serve our students again for this fall semester. Thank you, Dr. Hall.
Thank you.
And at this time, we're going to share video, summer video winner number 3. That was good stuff. Congratulations, Tony. I was kidding about going to Karina's for pumpkins and Annette's for toilet paper, but I think a lot of us may want you to come over. I really like that sliding door. That was good stuff. All right. We've kind of gone over a little bit, so we're going to take a quick 5-minute break, and we will be back shortly. Yes, I am. Welcome back. What a great first half. We just want to say a quick thanks to Dr. Jim Chang, Dr. Nancy Johnson, and Dr. David Hall. And we have more great speakers to come, starting now with Mr. Matt Alex. Matthew Alex is the founder of Beyond Academics, LLC. Prior to that, he led the student technology and transformation practice as a partner at Deloitte Consulting. Mr. Alex was named one of the Global Forum for Education and Learning's top 100 leaders in education and is an EdTech Awards trendsetter for 2020. Passionate about the future of higher education, he has guided dozens of institutions from the Ivy League to rural community colleges on their journeys to navigate the frontier of what is technologically and pedagogically possible. Mr. Alex has worked closely with all levels of executive leadership, key industry software vendors, and service partners to bring about a transformation. He also crafts several narratives to reimagine the university enterprise and bring the campus of the future into reality. Welcome, Mr. Matthew Alex.
Good morning, everyone. I hope you guys are all doing well. It's just an amazing time. It's always hard to go after someone like Dr. Hall, so I'll try my best, but it was just an amazing speech, and it's always tough to go after someone like that. And I hope that I can give you some of the insights that I really am passionate about and bring that passion to you all. First of all, let me thank Chancellor Lambert for giving me the opportunity to speak to you. We are in such an amazing time. What a difference a year makes for all of us. What a difference 5 months makes. And all the things that we are going through, it's something that's new for all of us. And as I speak to you today in the next 30 minutes, it's to get you to start thinking about what the future is going to look like and being able to give you some ideas how to look through that process. I've been in higher ed for about 30 years. I started as a clerk at a registrar's office in Chicago at a university at my alma mater. And I eventually, became really passionate about higher ed. I went on, in the past 30 years to design Stanford's student system, Cornell's student system, Miami-Dade's student system, City College Chicago, Spelman. And I'll be honest with you, the past 30 years, I haven't seen the transformation that we have gone through in the last 5 months. And while the 30 years were a really good indication of what we need to do in terms of the back office, what we really need to now think about is, what does campuses look like in the future? And this is the opportunity for us to all be together as we design the future of the campus. When we think about the future, it's going to involve you. It's going to involve everyone that is passionate about serving students, supporting faculty, creating the career paths for everyone that we interact with. And so I'm excited to have that discussion with you here. So when we think about reimagining the future, I will tell you, in the past 30 years, everyone was really comfortable with status quo. The reason we didn't see the transformation in the market is because everyone was comfortable with where they are. They're incumbents of what they do. They lose control if you change. There's fear and there's uncomfortableness that we all have to go through. There's also a sense of resistance because of the unknown that we all come into. So that's what the past 30 years are. But the past 5 months, I will tell you, institutions have to look at the opportunity that it presents us. It presents us the ability to reimagine what you can do. How can you do it better? How can you innovate? How can you renew your passion for the students that you serve? How do you transform how you educate? And so when we think about the status quo, we have to shift the mindset. And I will tell you, we have gone through a mind shift change. We call it the pandemic mind shift. And we'll speak about that as we move forward. And I'm excited to think about that. And I always like to start with numbers, because numbers carry, stats, and it carries, a connection. So I'll start with 3 numbers. It's 3, 4.1, and 400. And when we think about those numbers, number 3 represents the hats that students wear. Students wear 3 hats. And I know a lot of people don't like when I say this, but students are customers. Students are consumers. And students are products of everything an institution puts in them. And that's an important element. And as we speak through my presentation, I will speak about a customer experience, a consumer experience, a product that needs to be developed. And we need to think about that because they wear 3 hats. When we think about 4.1, it's really 4.1 million new opportunities. According to a Gartner research, 2.8 new million jobs, 2.8 new million jobs will be created with just AI. 1.3 million jobs will be gone. So if we add both of those together, there is 4.1 new opportunities to create skills, teach skills, reinvent people in the way that we need them in market. When we think about it, it is amazing the opportunity that it's giving us. And when we think about 400, it is actually 400 times faster than a blink of an eye. That is how fast data is actually processing information in the systems that you use today. And it's processing it at 400 times a blink of an eye. All you have to do is open up your iPhone or your Galaxy or anything. It looks at the screen and it looks at your face. It looks at all the million points in there and it lets you in because it processed 400 times the speed of a blink of an eye. So that's the technology that we have inherent in everything we do. So when we think about campuses, we have to recognize that our students, our digital natives, are used to 400 times a blink of an eye type of technology. So today I'm going to actually talk to you about 3 future ofs: future of student, future of work, and future of learning. And we're going to talk about these elements within that. I'm not going to bring out the numbers, but you will see how they all apply in the way we do it. And before I do that, I always put this screen up. I always say, we're always going to have a little bit of uncomfortable conversations. As I said earlier, when we move away from status quo, you're going to get uncomfortable. There's going to be fear, and that's okay. As a clerk, moving from one role to another, moving to one department to another, moving to a law school, and I had to do something different, there was fear. I was used to doing something. But a partner of mine said to me, in order to really transform, you need to have uncomfortable conversations. You have to think about what you're doing and be uncomfortable with what you're doing and recognize that there's transformation that can be done. So I'll add that as we keep going. So when we look at the pre-pandemic conversations, it's kind of pedestrian. And what I mean by that is we talked about cost pressures. We talked about rising tuition. We talked about the demographic shift. We talked about how to deal with Gen Zs, accountability, student success. We have cloud roadmaps all over the place. But we really never were addressing the transformation that we needed. And that was, how do we disseminate knowledge in a different way? How do we interact with our students in a much more scalable way? How do we make it accessible for everyone that needs an education? These are the discussions we're going to have as we move forward in the future ofs that I will speak to. So as I mentioned, we are going through a pandemic mind shift. And when we think about that, there's 3 elements that we will cover. One is the acceleration of the 4th industrial revolution. And I'll speak about that because I think it's important for us to understand that transformation that we're going through is not uncommon for my parents and even for me as I went through the transformations of what I came to today. The mind shift of being digital, that in itself is really powerful for you and your campus. And the pandemic mind shift also now has enabled you and leaders, provosts, presidents, chancellors, boards, registrars, anyone who is impacting students, faculty, you have a license to change. And that license to change starts about thinking about the future, reimagining what you do as you move forward. So when I talk about the accelerating the 4th industrial revolution, we've gone through industrial revolutions. The one that I will speak to right here is just the 3rd industrial revolution. When we think about Blockbuster and when we think about Kmart and Sears, they're no longer here because that industrial revolution of the internet and the connection of consumers online, those industries or those corporations struggled to think about the future. While Kmart was thinking about the inventory system and the cashiering system, and Blockbuster was thinking about how to, give their videos on VHS and so forth, Amazon and Netflix was thinking about how do we serve our consumers differently. So when we think about the 4th industrial revolution, which we are in today, you have to think about the 400 times the blink of an eye technology that we have. What are the things that we need to think about? So when I walk through the future of student and the future of learning and the future of work, I want to have you use a couple words. I want you to write down some imagine ifs. And when we say imagine if, don't be restricted by policies, procedures. Don't be restricted by what you know. Enable your mind to think about the future. And the reason I say that is the technologies that we have in our world today are readily available. And many of the imagine ifs that you will come up with, we actually can do in the technologies that we have today. And if those imagine ifs and those technologies do not exist today, we are at an exponential transformation in technology that you will see things happen much faster and sooner as you move forward. So when I talk about imagine ifs, and I'm going to give you each a little bit of what I know in my imagine ifs in these areas, but I think it's really healthy for you to create your imagine ifs for PIMA. It's important for you to create it for the student you know. Create it for the department you run. Create it for people you will serve next year. Use imagine ifs to empower the license to change. So when we think about being digital, you got to have a digital culture. You can't just say, I'm digital, I have a cloud product, or I'm on Zoom today. Those are just elements of a culture of being digital. You have to think digital. You have to be a part of the world that is already in a digital culture. So things that you will think about and address has to be coming from a culture of innovation, a culture of using solutions that you already have. I will tell you that your technologies within your campus has so much digital culture in it. You have to reach in and identify the imagine ifs to allow for the investments that you've already made in the systems you have to allow those to come out in the culture. Right now, everyone is handcuffed by policies and procedures. And this is the time, this is the license for you to say, we can't operate like 1990s. I ran a registrar's office in the 1990s. I could walk into most registrar's offices today and I will tell you how to run that office because they are not doing what is modern today. They're doing what we did in the 1990s. And this is the opportunity. So I apologize to any of my registrar friends out there, but I wanted to give that perspective of transformation comes from every office. I could have spoke about it in financial aid, or I could have speak about it in admissions, HR. I could speak about it in any capacity at a department, even the faculty. The key is creating a culture that your students embrace. When we think about digital utilization inside of being digital, you have to have a better presentation layer. You can't just do Zoom and expect that it's going to be an okay culture for them. Remember who we're dealing with. We're dealing with a Fortnite. We're dealing with EA Sports, who have robust communities. And that's who you will have as students as you move forward. So your presentation layer and your investments in your institution has to support the presentation layer for your faculty. I always say the asset within a university or a college is the knowledge. And that knowledge sits in the presentation and the way you disseminate information. You have to invest in that. You have to allow for that dissemination to be empowered through a presentation layer that is rival to Netflix, rivals to Fortnite, because that's what your students are going to want. And the ones that come even in the few years to come are going to be expecting that. Your interactions have to be in a much different way. We have to use chat. And I know there's a set of folks in the chat. I've been watching it on YouTube and I'd love to look at it, but then I won't pay attention to what I need to do here. And I will go back and look at all of those things. And I welcome you to engage with me. Right now, we're in a synchronous ecosystem. We're engaging synchronously through a visual. I also think there is asynchronous interaction. where after this presentation, you will still engage with me. You will still engage with the presentation. We also need to think about the collateral that we build. It can't just be presentations. You can't be just PowerPoints or PDFs. You have to engage in collateral that touches the hearts of the learning chemistries of your staff, your faculty and student. Those are the things that are going to make you digital as you move forward. And when we think about digital, it's also about being timing. I just spoke about synchronous and I just talked about asynchronous. When we think about timing, the power of your institution is going to become when you become polysynchronous. And what does that mean? It means that you have the ability to disseminate knowledge at any point in time. Just like this video would be watched later. Everything you disseminate knowledge should be a powerful artifact for your campus. It should be a powerful artifact for anyone that needs to learn from your faculty at Pima. So the timing is really important, is creating an on-demand model, a personalized model that allows you to really take on the power of being digital. The two things that we noticed coming out of March was the digital capabilities. That shined a light on all of campuses all over. It was clear that some campuses were very capable to go digital and some wasn't. And that's okay, because that's an opportunity that now we have gained with this exercise. If we would have told every school to go and become remote last year just for a month, nobody would have done it. We wouldn't have been able to see that capacity for digital wasn't there. But because we had to go through it, we now have seen it. So let's take advantage of it. Let's figure out where and how we become digitally capable to serve the students, give them accessibility where they need it, and allow them the capability to drive the vision that you will give them and they become a product of. The digital literacy is probably the one that I was probably the shocked the most. One of the things that we noticed when we were coming out of the pandemic, that early March, was that we recognized there was low digital literacy within the campus. And this is campuses that have LMSs and they have WebExes and they have learning management systems and students who have mobile phones. But we have students, faculty, staff who just couldn't navigate in the digital ecosystem that we all navigate when we go to Starbucks. When we go and check into an airplane, we navigate on our phone. The digital literacy was really low. And one of the things we will start to see is professional development around technology as we move forward in the new era of digital. So when we think about license to change, it's a forcing factor. And when we think about that, there's two paths. Some will fight it. Some will want to stay on course. Some will allow themselves to believe that what is going to happen is going to be exactly like it was last year. More likely than not, we're not returning to the same campus that you saw last year. You will have elements of it. You will not be the same. Competition in market will accelerate, as you will already start seeing. People will start becoming online. You will start seeing students selecting colleges that have more flexibility. You will see institutions peering with other institutions to collaborate with their educational model. You will see all that coming through. And then you will see others who will pause and reflect and recognize that change is really important as you move forward. So Dr. LeBlanc, who's the president of Southern New Hampshire, says, in a volatile world, rigid equals brittle. And institutions that cannot figure out how to work differently may not work at all. It's powerful and it is so true. He actually wrote this about maybe 2 years ago. So this is before, and this is what he was saying. And if you know Southern New Hampshire, they're very dynamic in the way they move. And that's why thinking about the future of student, the future of work, and the future of learning at this stage is important, because we got to become more malleable. We got to become more fluid. We got to use the advantages that we have to take advantage of where you want to go. So I'm going to walk through these pretty quick. I got 10 minutes, and I think a lot of this is going to be something that may resonate. It's going to make you feel uncomfortable at times, but there is some imagine ifs here that I think are really important. When we think about the future of student, we have to think about who the students are. They're consumers, customers, and products, like I said. Their digital expectations are greater than anyone that we'll ever see. My daughter is 17, is about to go to her senior in high school and looking at colleges. She's looking for a digital campus. Our students are value-based. What we valued is different. We lived in a default career model. Students of tomorrow look at the value and the impact that they can make. How can they become socially empowered? How can they allow for them to do greater things? And you will see what I would call a cross-disciplinary model for most students as they move forward. So the pandemic conversations always is, will the students be prepared for the next generation market that's in front of us? So my daughter, when she comes out of college in 5 years, maybe 6, the question needs to be asked, how will universities and colleges prepare her for the jobs that don't exist in the future? The 400 times a blink of an eye type of technology is going to advance practices more faster. How do we prepare them? That's why having a digital campus and being digital is really important, because then you're fostering the digital culture for who comes through your campuses, and then it will eventually come into market, and they have the ability to navigate in that market equally. How will campuses differentiate themselves through the digital experience? So when an Econ 101 course is taught at PIMA and at UA and at ASU, how do you differentiate yourself? It is through the culture and the affinity and all the things that you would add on that allows for that to come through. Now, does your campus really matter? It does. The connectivity to your campus, the connectivity to your faculty is really important, but it has to be complemented by a digital experience as you move forward. And when we think about courses, it has to be tailored and personalized. We got to look at pathways and guided pathways as we think about it, but we have to be nimble. We have to unbundle education in a lot of different ways so that we allow for the personalization and even the aptitude. Think about the number of students who come to your campus who may be really good in one subject but isn't good in another. How do we allow for the education to bring them up to par as they go forward? All things that we got to think about. So when we think about the imagine ifs, this is my imagine ifs. Imagine if attendance could be taken with facial recognition. I don't need a faculty to tell me who's on campus. Imagine if AI could be used like Alexa to do research. Those are just some of the imagine ifs. Imagine if transcripts were on a digital wallet. The reality of it, a lot of that's already happening. So when we think about the future of work, and I call it the future of the campus enterprise, this is where we all work. When we think about a campus, and I'm going to be speaking to some of you later on today, future work is really important. And future work starts at the campus. We think about what the work is. Who does that work? Where will that work be done? When will that work be done? Those are the questions that we need to think about when we think about future of work. Don't be afraid of it, because it will empower you to bring your human capabilities to serve students. And I'll speak about that in those sessions later in the day, and I'm open to anyone that wants to reach out to me and have a discussion around future work. When we think about the future of work, we need to have a campus that is digital, that enables the digital world to really evolve around you. I use something called the innovation maturity model. And what that really means is you have to appreciate all the innovations prior to really take an advancement of what you move forward with. Because think about the iPhone today. We had to go through the iterations of the innovations within it. And now we have location intelligence and we have facial recognition. But in order to do any of those, we needed other elements of innovations to be there. And you have to appreciate that. So what you have to do is think about the innovations that are already here. And then you have to embed that in the future practices of how you transform your campuses. You have to reimagine the work, your nature of work. What are you really doing? What's the spirit of the rule? We are based on a rule-based campuses in most cases. We have to become a human-centric campus in the way we drive. So when we think about the pandemic conversations is imagining the workspace virtually if possible. We've gone into that already. Does everyone need to be on campus? What is the culture that you will think about in the way you augment your campus workforce also? So the imagine ifs is, how do we automate things that allows for staff to do meaningful interaction? Imagine if peer-to-peer collaboration could collectively teach students. Imagine if campus processes took minutes and not weeks and months. Now, when we move to future of learning, we really are thinking about the students that really matter in the world and how do we teach them. I already talked about a little bit of this in my other elements. You got to create a digital educational marketplace. You're going to be in a competitive market. You have to think that way. You need to have a personalized path, much different than the 1990s. You're going to have to think about accessibility, and you got to think about the learning chemistry. We learn in so many different ways. I learn visually, some learn auditory, some learn through contextual, some learn through hands-on. Everyone has it. So we have to create content as we dive into it with a learning chemistry in mind. And then we have to think about the uncomfortable conversations. Are we focused on teaching or learning? It's a discussion we should have. Are the majors and course designed for virtual consumption? Could you do what you do in a classroom virtually? What are the things that you can unbundle in a 4-year degree, a 2-year degree that allows for more people to consume it on demand? For that single mother who can't take a 4-week course or an 8-week course or a 12-week course, how do we make it accessible for her? So when we think about imagine ifs, it's imagine if we had micro-credentialing possibilities. That's already coming in market. You will see Google coming into the play. We think about how do we create digital pathways with learning chemistry, where the pathway and the way that they learn has a certain type of model that is more influential for the student in their learning chemistry. How do we own the learning credential? How do students own it? Blockchain and others are going to be an incredible part of how we drive. How do we use library content in a way that it's at the fingertips of not only people on campus, but globally? So I got a few more minutes and I'm going to dive into 2 mindsets. Right now, most campuses are an institution-centric mindset. It's driven by processes, it's driven by the technology, and it's driven by how do you manage the campus's institutional visions. And it's not a very friendly one for students. What we have to start moving towards is a human-centric mindset. Reimagine how you serve. Reimagine the outcomes that you want your students to have. Think about the personas that you will do. What are the value drivers that are going to be there? What are the moments that matter in the journey that that student will go through? And so this is an important element as we look at the new normal. I put a roadmap up there. We look at it in 3 phases. Now, because we're managing the pandemic, you need to probably do a digital twin type of campus where you serve people who are on campus and can actually do virtual. You enhance your online offerings as much as possible, and you maintain enrollment. In the next 12 years, you have to increase the online reach. You are going to go into a competitive landscape that will require you to have an online reach. Why? Because people are going to reach right into your ecosystem. You need to have a human-centric value. You need to think about things in an asynchronous or a polysynchronous way in the next set. You also got to think about a flipped campus where the most important human elements are being done on campus, and things that can be done more structurally could be done remotely. You, of course, need to increase enrollment as you move forward. And as you increase more online offerings, you will increase enrollment. And then have an entrepreneur path in the long term. Be evolutionary as you move forward. Think about your curriculum in a polysynchronous way. Partner with industries, create an educational marketplace, and drive the expansion of enrollment through that process. You want as many people to experience Pima Community College as possible. And that's going to be a driver as you move forward. And I know Chancellor Lambert has a great vision, and I always end this in my presentations. You can design your campus today for tomorrow, or you can design tomorrow today. I want to say thank you. My email is here if you want to reach out to me, my Twitter, as well as my LinkedIn. I would love to connect with any of you on these topics, but I appreciate the time, and you have great things in front of you. Have a great year as you move forward. Thank you so much.
Thank you, Mr. Alex, and I'm sure I speak for a lot of us that we're glad you're coming back for more events later today. Digital wallets, Imagine If, polysynchronous, more technically advanced, but human-centric. Some of this we're working on, but we've got a lot of work to do. Thank you.
Thank you.
Some of us have not been on campus since March 16th. Some of us came back in June when our students returned to campus to complete hands-on competencies. And if you've heard Bill Ward, some of us haven't left at all. I want to take a quick thank you and thank Bill and the facilities teams, Chief Buddy Janes and our police officers, and definitely our faculty and staff that have been back on campus to help keep things moving for our students. We learned a lot, and to show you how serious we are about safety protocols, we're bringing out the big guns, hailing from Erie, Pennsylvania, and here to tell us more about what to expect for fall. Please welcome our President of Campuses and Executive Vice Chancellor, Dr. David Doré.
Thank you, Greg. Good morning, everyone, and welcome once again to All College Day as we prepare for the beginning of our fall semester. I want to begin by thanking each one of you, our employees, for the incredible work that you have done and continue to do to serve our students in the midst of the challenges of this pandemic. We have made significant changes at Pima Community College to ensure a safe learning environment for all of our students and employees, and I commend every one of you for the adaptability and innovation that you have brought to responding to these challenges. Now, what I'd like to do in the next few minutes is to go over entry protocols with you for those of you who will be coming on to one of our campuses or centers this fall semester. And I want to begin by showing a video. This is one of many videos that has been produced for our students, because we want also to make sure that our students feel comfortable about coming back, for those who will be coming back. And I want to give a shout out to the Arts Division for producing this video. And what this does is help our students kind of see what it is to come on campus and what some of the expectations are. So let's take a minute to watch this. Thank you. Go to our next slide. So, I want to echo Greg's words and really thank everyone who has worked so hard over the summer and in the spring to ensure that we have a safe environment for all of our students and employees. And I particularly want to really express my appreciation to our provost, Dr. Duran Serta, Dr. Lamata Mitchell, and all of the deans and the team that has worked so hard, our Vice Chancellor, Bill Ward, and all of his team, campus police, facilities, and the campus vice presidents, our leadership of student affairs and student support, and then all of those support services. We have, if there's a, one thing that's come out of this pandemic is incredible collaboration. And what we did as we looked at the fall semester is we really examined multiple scenarios, and we mapped out all of our campuses and locations site by site, hour by hour, and going back and forth with the provost in terms of what is the safest way that we can bring students back. And so in this slide, you see this is really our capacity by hour at all of our campuses and sites. And so what we've done is we're looking at a model very similar to what we did in the summer. And I want to say that I'm very proud of the team that has worked so hard, because since this pandemic occurred in March, we have had no reported cases of anyone contracting COVID on any of our campuses. And so we're very, very proud of that. And safety has been our highest priority. So what we've done is, as I said, we really are bringing back a small population on campus. And I want to go through the campus approval process with you. So what we call blanket approvals, and that's approvals for faculty and staff for instructional programs and support programs that we are bringing back. That process will continue to stay as it is. That process will be a collaborative effort between the provost, myself, the president, and then making recommendations and working with Vice Chancellor Bill Ward, and then making recommendations to the Chancellor on bringing back programs. And we have made our fall plans we presented to the board this past Wednesday, and so our plan is finalized and we're ready to begin that process. Now, the one thing that is changing are those one-time visits and check-ins. Those were going through the executive level, so they were going through the provost or they were going through the president. Those are going to shift to the campus vice presidents. And so the campus vice presidents are responsible for the entry process of all of the programs and faculty that have been pre-approved. So if a faculty member is scheduled to teach on Wednesdays afternoons, they're pre-approved to enter, and the campus vice president facilitates that process. For the one-time check-ins, any employee that needs to go to a campus or a center to get something, those approvals will go through first your supervisor, then it will go to the supervising administrator, and then it will go to the campus vice president, who will then notify the campus, the campus police, the chief of police, and then that will complete that process. And that process goes into effect today. And just so everyone knows who our campus vice president and who's going to be responsible of the site, Morgan Phillips is responsible for the downtown campus and the Aviation Technology Center. Edgar Soto is responsible for the Desert Vista campus, Ted Rausch, the East Campus, Brian Stewart, Northwest, and Aubrey Conover, the West Campus. So all approvals for any of those campuses will go through those respective campus vice presidents. I also want to mention that anyone who would enter Davis-Monthan or the Santa Cruz Center would go through Ted Rausch as well. Additionally, the adult basic education centers, anyone that wants to enter that center would need to get approval from Lori Kierstead-Joseph. And then for the PSESI at 29th, the approval would need to go through Ian Rourke. And so that is our process. Next, I'd like to just review with you the entry protocol. So, as I mentioned, you will get email approval, and that will go through the campus vice president, and it will go through the chief of police. Then you will park in a designated parking lot. Most people are bringing their own masks. If a mask is not provided, we will provide a mask for you. You will check in, you will get your temperature taken. Now, it's very hot right now, so if you've been sitting in a hot car and then walking to, you may actually have a high temperature, so we'll let you sit in a cool spot to cool down. The other day, my temperature was high, and then it went right down when I cooled down. And then a wristband is provided. The wristband really allows us to know who has gone through the check and is actually authorized to be physically on the campus. Because anyone who's not authorized to be on the campus will be escorted by the campus police off the campus. And then there is, as you saw in the video, there is directional signage. And then there are specific protocols, additional protocols for the actual instructional programs. For example, our healthcare programs will actually have more stringent protective equipment, personal protective equipment requirements. And there are, again, processes that we will be using throughout to go on to those campuses. And so that really concludes our process. I want to emphasize that your campus vice president will be monitoring on a regular basis. We do unannounced checks of all programs. I myself will be walking through all of the campuses on a regular basis to do checks to ensure that all of the safety protocols are in place. And I want to emphasize that safety has been our highest priority, and we want our students to learn in a safe environment, and we have tried to balance the fall schedule so that students are able to complete their educational pathways and do that in a safe environment. And so, Greg, that completes my overview of the protocols, and back to you.
Thank you, David. Of course, that was a lot of information. Don't worry, we will be getting that out to everyone so we all know what to do and handle the situation correctly. Well, we've heard a lot of guests this morning speak differently about our theme, Reimagining the Future. And now, to bring us home, I would like to introduce the winner of the Pima Association of Governments Thomas L. Swanson Leadership Award, our fearless leader. He's not afraid of spiders, heights, or clowns, but standing still and growing stagnant, I think that bothers him. Please welcome our Chancellor Lee Lambert.
Thank you, Greg, and good morning, everybody. I just want to first start out and say thank you to each and every one of you for your patience, your perseverance, the leadership that so many of you have shown to help transform Pima over the course of the last 5 months, getting us ready for this unprecedented beginning of this fall term. Also, I just want to thank our governing board. Without their support, their leadership, none of what we've done the last 5 months and what we've done the years prior would be possible, putting us in a great position as we move through this current health pandemic. Also, I want to recognize and thank the keynote speakers, Drs. Johnson, Chang, and Hall, and Mr. Matthew Alex. They really honed in on, I think, what I'd like to refer to as the perfect opportunity. For those of you who are familiar with Chinese, know that the Chinese symbol for opportunity is also the same symbol one might refer to as danger and crisis. So it's really incumbent upon us to decide how we want to look at our current circumstance. And I see that we have a great opportunity to take the pandemic of health, to take the challenging demographics that are before us and the changing nature of the demographics, to really address the heart and soul of what social justice is about and really face the future of work and learning. And I just want to also thank all of the essential workers in Pima County and throughout the state of Arizona and our nation. Many of the individuals in our community are trained and educated by Pima Community College, our first responders, our nurses, our other healthcare professionals, other folks who work on the front line. Many of them come through us, and so we should all be proud of those folks who are out there each and every day looking after all of us who are not on the front lines of this health pandemic. Also, I want to thank and recognize our own essential workers. It's easy to overlook the fact that we have a group of essential workers. We have our police department. We have many of our maintenance folks. We have folks we wouldn't be getting paid if our payroll folks hadn't come in to make sure they processed payroll appropriately. And so many others of you who have been on the front lines of this pandemic. Thank you, thank you. I want to start out with the story of Doré. Doré came to Pima just a little over a year and a half ago. And he came through our adult basic education program. And he immediately was able to connect with our adult basic education staff. They connected his interest with our AIT program through iBest. And I'm pleased to say in just a short period of time, Doré was picked up and given an internship with Roche Tissue Diagnostics after successfully completing this program. And then he's been hired to take his skills, his electrical and pneumatic system skills, into a job which is now paying him $18 an hour. That's 8 months after he completed that first level AIT certificate. This would not happen without the great work of our faculty, the great work of our staff, the great work of our administration coming together and saying, what can we do to make sure we provide an outstanding work and learning environment for our students? But also, Doré's experience also really highlights this new reality, the reality of the human plus machine. So why don't you go ahead and put up the slide and play that video for us. South Korea is one of the leading nations in the world being responsive to this healthcare pandemic. But what underlies their ability to transform their society, at the root of it, is a commitment to education. And that education is essential for us to prepare and recognize that that preparation is into a human plus machine world. It's going to require that we, as educators, and I mean we, all of us who are involved in working at Pima Community College, from the front lines all the way through the faculty, to the back offices, to the chair I sit in, to the governing board, we are all educators. And we sit in this important intersection. But for meaningful learning to occur, it occurs at the intersection of comfort and discomfort. And it is incumbent upon us to help embrace that reality so that we can help in turn support the success of our students and our community. On March 12th, as all signals started to point towards this new reality rushing upon our great nation, the United States, we also recognized here locally that we were going to have to make some of the toughest decisions ever made in the history of this institution, and that was to suspend our face-to-face operations. And then we began the process of moving towards what we are now living, a virtual operation. And I'm so proud of each and every one of you for stepping up and making that transition happen in support of our students. And as President Doré just mentioned, we put health as the focus, health of each and every one of us, of our students, our community, and our employees, first and foremost, and then bringing alongside that the continued focus on fulfilling our mission in support of our students and their success. But make no mistake about it, we are now in a new reality, and it's up to us to decide what we make of it. The human plus machine world is here, and I want to make sure that the United States, us here more specifically in Tucson and Pima County, can be competitive with the South Koreas of this world. Ella Baker, a civil rights icon, once said, "In order to see where we are going, we must not only remember where we have been, we must understand where we have been." So 8 years ago, why don't you go ahead and put up the slides. This month represents my beginning of my 8th year at Pima Community College. I stood before all of you who were here at that time, and I shared a video with you of an airplane flying as they were remodeling it. I think it was very apropos for the circumstances in which we were faced with. And so let me just touch on a little bit about remembering and not forgetting our past, the good, the bad, and the ugly. When I arrived, Pima was on probation, not for the first time, but for the second time. Not many institutions find themselves in such a situation. We were on probation with the Department of Education for the rate of loan defaults. Not too long after I arrived, I was informed that we were on the verge of losing our ability to certify veterans for their benefits that they so aptly earned defending our nation. And then, as time progressed, I learned that many of our employers were close to giving up on Pima. We, prior to my arrival, much conversation about the fact that Pima had all but eliminated developmental education, cutting off the access point to so many folks in this community. And then as the first year progressed, we learned that our state funding would be completely zeroed out. These are just a few of the many challenges as your chancellor faced with each and every one of you that were here. But the great news is we made it through that, and I'll touch upon more of that a little later. I also want us to understand, in part, the lessons that we can take away from this. Vision is rooted in trends and data. We also realized that the silos of the 6 separately operating campuses were no longer going to meet the requirements necessary for us to function. In fact, I asked our accreditation liaison officer, why do you think Pima struggled so much, especially with accreditation? And the answer was simple. You act as if you're 6 separate institutions when you are accredited as one. We had cumbersome policies and procedures. We had inattention to laws, regulations that come from the state and federal government. Lack of intentionality around investing in our employees' professional growth and development. But most of all, we started to put a great focus around student success, community engagement, diversity, equity, and inclusion. So I'm so proud that we not only were remodeling that airplane 8 years ago, we have in fact started to build new airplanes and the airplanes of the 21st century. Why don't we go ahead and go to the next slide. So I want to share a little bit how we did that. And it was through the focus on the 5 gaps. And when I interviewed here a little over 8 years ago, or actually a little over 7 years ago, I talked a lot about the fact that higher education needed to change and focus on closing 5 gaps. Well, PIMA, that has been the focus, that has been the vision that has guided the work here of this institution. And I'm so excited to say that we are making great progress in closing each and every one of these gaps. And I'll give you some examples. I believe PIMA has won its first ever Bellwether Award. And that came from our focus on closing the educational achievement gap, especially looking at the issues of developmental education. So many people to thank and acknowledge in that area. Just know that focus has led to us being acknowledged as one of the leading institutions in the United States of America. Also because of our work, PIMA was asked to join a group of prestigious liberal arts institutions to focus on making the liberal arts relevant in the context of this new workforce reality. So I've been invited through the MIT initiative called J-Well to participate in conversations with Kenyon College, Wheaton, Davidson, Simmons, Babson, Wellesley, Trinity, and Lehigh, and more. Because there's something we've been doing here at PIMA they find very valuable to help guide the conversations that they're underway. And by the way, we're the only community college at the moment at that table. Also, we have put tremendous focus around closing the global and diversity gap. I want to thank the folks in our international department for the tremendous work they've done. And 2 examples I want to highlight from their work. One is the focus on building partnerships with 4-year colleges and universities, and especially during this period of time where it's very difficult to recruit internationally. They've partnered with Boise State, SUNY, and Pittsburgh as examples to create a virtual recruitment fair, which has already reached over 250 students in 41 countries. Also, PIMA was recently recognized with the first Emerging Leader Award by Diversity Abroad. Now, why were we recognized? Because we have substantially increased the number of Latinx students participating in study abroad programs. We have doubled the national average of Native American students participating in study abroad programs. We are making sure that our students of color get to participate in the opportunities to expand their future by having an opportunity to visit and experience other countries and other cultures. So thank you. Also, the technology gap, and I'll touch more on that a little later, but I'll just highlight this one piece. I'll highlight 2 pieces. I want to thank the board for supporting the investment of $2.5 million of our CARES Act funding to help support closing the digital divide. We have purchased the computers, we have purchased the hotspots, and we are in the process of disseminating and deploying them as we speak to our students. Also, I want to recognize Kim Lisa. Kim Lisa was part of the visiting team to Shoreline Community College, where I was formerly the president. She knew that PIMA needed to move its online offerings into a more strategic, more structured focus. And when she saw that is exactly what we did at Shoreline, and when I arrived here as your chancellor, she came to visit with me. And she asked, can we do something similar? And I simply asked her, please draft the charging document for putting together a committee, and you will have my support to start to move PIMA into a much more robust online environment. And thank you, Kim Lisa, for that, because if we had not have done that, going into this pandemic, PIMA would have been caught off guard. Fortunately, we had built the infrastructure, and it all started with someone's vision. And thank you, Kim Lisa, for that. Also, we've been focused on closing the sustainability gap. There's two components to this. One is really addressing climate change. And when I arrived here and I looked around in Solar City, America, Tucson, Arizona, but what was missing was PIMA Community College was not a place where you could see solar. And thanks to Bill Ward and his team and so many others, and thanks to the support of the governing board, we have solar at each of our campuses now. We are now in the game with a visible focus around sustainability and addressing climate issues. Just as an example, this one investment over the last fiscal year has resulted in over $500,000 in electrical utility cost savings. I will talk a little later about the other aspect of sustainability, and that's the sustainability of PIMA Community College itself. Also, the skills gap. We have placed so much attention on closing the skills gap, and as I mentioned earlier, many of our employers pretty much had given up on PIMA Community College. You wouldn't know that today. So many of them are looking to us, not just here locally, folks are looking to us across the state and across the nation to help them address the skills gap challenges that have been accelerating. So much so that we are now, I'll give you some examples. PIMA is the first registered apprenticeship-sponsored community college in the state of Arizona. We have built in partnership with Caterpillar, the Applied Technology Academy. And I'll just highlight one more example. We were asked to work with a group of individuals across the state to put together a proposal to submit to the National Governors Association and the American Association of Community Colleges to be part of the Reskilling and Recovery Network. And I'm so proud to say that PIMA is part of the Reskilling and Recovery Network for the state of Arizona, and I have a seat on that group. And so we're leading in so many ways around closing the skills gap. But what's powering this skills gap? Can we pull up the next slide? It's the 4 superpowers. And many of you have heard me talk about the 4 superpowers, but I want to put this in a large context for a moment. How many of you have a cell phone? How many of you have another mobile device or a laptop? I think many of us do, if not all of us do. We have more computing power in our hands today than that Titan missile system silo that's here just located south of us. Can you imagine that? And those of you who grew up here, you know about the Titan Missile Museum. Well, guess what? We now have more power in our hands than they had during the height of that location. So what does this mean for us? Well, the 4 superpowers are AI, mobile technology, the cloud, and the Internet of Things. So I want you to just ponder with me, if you will. So how are you using these in your daily lives, in your professional lives, in teaching and learning? Can you imagine a virtual or digital railway from Santa Monica, California to Jacksonville, Florida? What does this have to do with PIMA Community College? Can you imagine walking into any classroom at PIMA and it automatically senses your presence and adjusts the cooling and heating accordingly? Can you imagine being able to have access to the advanced building controls from your mobile phone or tablet? That's any of us at any given time from anywhere in the world. Can you imagine a student attending an anatomy and physiology class through virtual reality or augmented reality? Can you imagine learning to hack hackers in real time by going into the dark net? You may be thinking to yourself, what does this have to do with the mission of Pima Community College? What does this have to do with diversity, equity, and inclusion? I say it has everything to do with Pima Community College, and it has everything to do with diversity, equity, inclusion. In fact, let me translate some of these questions for you. Pima Community College, in partnership with Too Simple, have developed the first ever autonomous vehicle program in the nation. This program is getting attention across the world as well as across this nation. We are part of developing what is not futuristic, a true virtual and digital railway extending from Santa Monica, California to Jacksonville, Florida, and guess where it starts? It starts in Tucson, Arizona, and your Pima Community College is part of this exciting future. Also, we have partnered with Train Company to begin the process of turning the entire Pima Community College into a living laboratory. We're not just going to be a place where learning happens in a classroom. It's going to happen in every part of the college. We're going to partner with the University of Arizona and other partners to extend that living laboratory so that our students can learn in real time how to use these advanced building control systems. This is game-changing, what Pima is entering into with Train Company. No other community college in the country has turned their college into a living laboratory. And this is going to give students the hands-on, work-based learning skills they so desperately, and they're going to learn on the most sophisticated tools. And it's important that they learn these sophisticated tools, because once you learn on the best, you can do anything else from there. Why should we expect mediocrity any longer? I say we expect excellence. And this program will exemplify that. Also, a group of us went and visited Case Western. I'm sorry, not Case Western. I'm getting the college wrong. We went to Ohio and visited a college there who was using Microsoft's virtual reality tools to look at the human anatomy. We were invited by Apple headquarters, and while we were there, we saw the augmented reality looking at the human anatomy among many things. Well, guess what? We will be piloting this technology with the human anatomy in some of our programs as we move into the year. And Pima Community College is the only college in the state of Arizona, and I believe maybe still in the nation, who has a cyber warfare range that is a live fire warfare range. Many places have a cyber warfare range, but it's simulated. Ours is live fire. This is the opportunities we're bringing thanks to the 4 superpowers. None of this would be possible without that, but also would not be possible without our faculty, without our staff and administration and our governing board supporting this transformation that is underway. We're doing it, folks. This is not futuristic. The future is not the future of work and learning. It is now, and Pima Community College is leading that. Now what we have to do, and what you heard Matt and Alex talk about, this has to become the standard of the college. This has to become the mindset of the college. These are still pieces we're doing. Now we have to bring these pieces into a unified operating system. But as we do that, we must not lose sight of the fact that we are a social justice institution. Let's bring up, and we must make sure that every one of our, the next slide please. We need to make sure that every one of our students, especially our black and brown students, enjoy the opportunities that the 4 superpowers are providing to our communities. They should be part of the opportunities to be the next billionaires, and dare I say the next trillionaires, because the 4 superpowers will create the next Bill Gates, the next Paul Allens, the next Steve Jobs. You get my point. We need to make sure that women and people of color are also the next set of billionaires and trillionaires. And that comes from a commitment to social justice, a commitment to equity. And when we had Dr. Kendi here last weekend, and one of the things that stood out for me in what he said, he said there's really three options in moving forward. One is the gradual approach. One is to make systemic changes now or stay to status quo. I think you all know my position on this. I think you all know the board's position on this. We're not going to make and continue to be a status quo institution. Gradual is not going to get it done anymore, folks. We've got to make systemic changes, and we need to make them now. Great news is we had been working on becoming a more socially just institution. Pre-COVID and pre-George Floyd, we had put together one of the first ever formal written diversity, equity, and inclusion plans in the history of Pima Community College. We established the Ethnic Gender Transborder Studies program. We established the Diversity, Equity, and Inclusion Center. We hired a diversity and equity officer. We established the Center for International Education and Global Engagement. We have just completed the first phase of our guided pathways work. We are getting ready to be able to enter into our first of many centers of excellence facilities. And I emphasize facilities because the Center of Excellence is not about a facilities in and of itself. But the facilities is a physical manifestation of our commitment to centers of excellence. Also, we've invested in more professional development to ensure employee upward mobility. Since I've been here, just about 40% of all promotions at this college, or people having opportunities to move up, have happened. That comes from a commitment and also making sure that that upward mobility extends to our employees of color. Also, the unconference that I made reference to just a moment ago with Dr. Kendi and Dr. Rendon as our keynote speakers last Friday and Saturday was already in the works prior to COVID, already in the works before the George Floyd murder. And of course, many of us, and I'm proud to say, participated in the book club focus, a virtual book club, mind you, on how to be an anti-racist. If you have not had an opportunity to read Dr. Kendi's book, I highly encourage you to do so. I think it will help you rethink how we approach the work of social justice. And I also want to thank Greg, who also was a co-presenter, also Mays Ahmad, Kate Schmidt, Hilda Ladner, Yolanda Gonzalez, and so many others who have been very instrumental in making all of that a successful event, as well as dialogues that have happened over the last few months. So now let's talk about social justice and COVID and beyond. What has happened? Our governing board issued a statement supporting anti-racism. We did the Dr. Kendi book reading. We held a community forum with the black community, thanks to the leadership of Dr. LaMotta Mitchell and so many of our black employees. Our faculty senate is launching a systemic justice action committee. The provost is launching a breaking barriers committee. My only challenge to both of you, this can't take a year. This should be less than a few months. We need to move on the work. We need to move from planning to implementation. We're going to establish African American Studies and Asian Studies at Pima Community College. And we're going to work to accelerate the discussions we've been having with our adjunct faculty to improve their working conditions. We must do better by our adjunct faculty. And I'm committed, and the board is committed to doing so, and we will do so. I also want to say to all of you employees, if you're working at a certain level of the organization, I want to make sure you're recognized for your work, and that your work be appropriately elevated and recognized, and paid commensurate with that level of work. And so I'm so happy to announce I'm modeling the way with the cabinet group. But this modeling is going to happen throughout the college. Recently, we have retooled the work of risk management, our focus on regulatory compliance, and obviously the work we've been doing around accreditation and so many other key pieces. We've retooled that work, and that work will now directly report to me as your chancellor. And the person who will be leading that work for us, who is doing much of the work prior to this reframing, and oh, by the way, just as an aside, when I was asked to attend a meeting by the Department of Education with a group of other colleges who had issues with their default rates with financial aid, and they said to us, you should have your Office of Financial Aid directly reporting to you as the CEO. This is serious business, folks. If we lose our Title IV eligibility, we will not be Pima Community College. I took that perspective seriously. I also took the fact that they said you need to put a focus on risk management. I took it seriously. And as a result, I'm pleased to announce to all of you today that Dr. Bruce Moses will be our Vice Chancellor overseeing those areas. So when you get a chance, please congratulate Bruce. But also I want you all to know that I have two other people who report to me who have not been recognized for their level of work. Dr. Nick Richmond and Jeff Sylvan will now also be Vice Chancellors. But this doesn't stop here at the cabinet level. We're going to make sure everybody gets recognized for their level of work with the appropriate titles and appropriate pay. And that's why we're doing the class clamp study. That's why we're going to seriously look at doing better by our adjunct faculty and so many more as we go forward. Also, we must remember, we must ensure that every program of study will lead to a meaningful careers and life outcomes for our students. And as you've heard this morning and re-emphasized through Matt Alex's presentation, we are now in a human plus machine world. Industry 4.0 has redefined the landscape, and every one of our programs must incorporate this new reality. Otherwise, we are not living up to the commitment of social justice for our students of color so that they can compete on the same levels as our white students. And we need to always remember that it's about the soul of who we are. That original sin that Dr. Hall talked about is what we must work to never return to. So bring up the next slide, please. There's no going back. Now, I've heard some say that can't wait. I've heard some people say that they can't wait for us to go back to the pre-COVID world. And I'd rather ask you this question. Why would you want to go back to our pre-COVID lives? Back to the original sin? Really? The pandemic of health has shown us that the digital divide is real and it's impacting our students of color the most. Disparate economic outcomes have been clearly highlighted during this pandemic, where our black and brown folks are more greatly impacted from not only economic effects, but also from the disparate health effects. Is that the world you want to go back into? And let's talk about higher education. 40 million adults have some college and no degree, many of whom are black and brown students. In Pima County, there are nearly 170,000 individuals, many who are black and brown, who have some college and no degree. And by the way, that's a larger number than all of the students, or nearly all of the students who are currently in our K-12 system. Is that what we want to go back to? There are over 35 million students who hold federal student loan debt totaling in excess of $1.6 trillion. Is that the world we want to go back to? Now imagine this. Unfortunately and sadly, many of our students of color are having to attend for-profit colleges because our public colleges have not made it easy for them to be students. We have erected too many barriers for them to enter our institutions, so they enter these for-profit institutions who do not put up tests in front of them and who embrace them, I hate to say it, but in a way that is misleading in the end. We can do better. We should not be sending them to these for-profit. We should make sure that they're welcomed here at Pima Community College, and we make it easy for them to be students, not difficult to be students. And I'm so pleased that our work of our student services people are doing exactly that, making it easier for our students. But think about this as well. If we, as higher education institutions, have been focused on equitable outcomes between 2013 and 2015, if we had made sure that access to our engineering programs were equitable and that outcomes were equitable, we'd have 20,000 more engineers of color today. And if we would have ensured that access was more equitable and the outcomes were more equitable in our education programs, we would have more than 30,000 more teachers of color. So I ask you, do you really want to go back to a pre-COVID society, back to the original sin, or do you want to join me, join our governing board, and join so many in this community for once and for more? We are going to close the equity gaps. We are embracing social justice as the heart and soul, the operating system of Pima Community College. So let me talk about what the focus will be for the upcoming year. We're going to focus on really remaking a lot of our programs to be relevant to this new reality. We're going to be focused on the version 2 of our guided pathways. We're going to be doing more work around equity, diversity, and inclusion. We're going to be turning our student support operations into a more human-centric model. But I want to touch on 2 last pieces, and I know my time is running a little longer than I had anticipated. One is, I have to talk about the reality of our financial stability. I talked about the sustainability earlier. Well, our board, recognizing that these uncertain times, given the demographic shifts you heard earlier, given the reality of the health pandemic, that Pima is going to be in a difficult place, like so many other colleges and universities, they decided to unanimously place on this November ballot Prop 481. This is not a tax, folks. It is also a permanent base increase to the base expenditures per FTE at Pima Community College. And some of you may or may not be aware, but in 1979 and 80, when this law was passed, Pima had the lowest spending per student FTE in the state of all of the community colleges. But what happens is that base expenditure becomes part of the formula for determining our current expenditure limit. And at just a little over $1,700 a student, we are a little more than $1,000 below the system average. So we're asking to move our base limitation up by a little over $1,000 to be on par with the system average. Also, there are other factors that go into the formula, the enrollment piece, and you heard Dr. Chang's presentation, and also there's a cost of living factor. We have to use what we call is a gross domestic price deflator, which has only gone up 3 times since 79-80, versus using a higher education price index, which has gone up 5 times. And those of you who are in our science programs and our healthcare programs and a lot of our advanced technology programs really understand this really well. So just to illustrate, to train a nurse at Pima Community College costs just about 10 times as much to educate a student in history. But that was not contemplated in the 1979-80 law because back then, we weren't talking the 4 superpowers. We weren't talking the human plus machine reality. Also, I want to talk a little bit about the reality of this year. Like our students, who must prepare to acquire or strengthen their digital skills, their social emotional skills, and higher cognitive skills, us employees, we must do the same. Our enrollments are not looking good right now. We're probably going to come in somewhere around 20% in the negative. This is not unlike many of the community colleges in the state of Arizona or across the country. And in some cases, some of the universities are looking at deeper cuts or reductions in their enrollment. And it has been my commitment when we went into this pandemic to minimize the impact on each and every one of you. And that still continues to be my commitment, the board's commitment, commitment of this administration to minimize the impact of these fiscal realities on each and every one of us. However, I can't sugarcoat it. We can't completely avoid the impacts. And so we'll make sure we include you, share information when we can about this reality. But also, I encourage you, if you know that you're not up to speed with digital skills, if you know you're not up to speed with the social emotional skills or the higher, please let us know so we can get you into a professional development program, so we can reskill and upskill you appropriately so you still have a place when we come out of this pandemic, and we will come out of this pandemic. But I want to make sure you are properly trained to continue to be in roles at PIMA. But you have to do your part. You have to be willing to be honest with yourself and with the college that you need the reskilling and upskilling, because we are in a human plus machine environment. Also, I just want to reiterate, if you're a parent of a school-age child, we will work with you to accommodate you. Also, if you are taking care of a parent or a grandparent who's been impacted by COVID-19, we will work with you, accommodate you where appropriate, to find an appropriate work solution. If you have an underlying condition that makes you susceptible to the negative impacts of the virus, please contact our human resources, our ESC, so that we can work with you to develop an appropriate accommodation plan. However, if you have little or no work to perform, because our on-site operations have been scaled back to just about 20%, as David talked about, please let us know this so we could find a way to help assign you into a different role where it's appropriate. But if you don't tell us that when we come out of this crisis, I think you can understand what may be an unnecessary impact to you personally. But please come forward. I'm asking you to do so. Let me end with this. We stand at the intersection of hopes, dreams, aspiration, and goals. Each of our students count on us to help them reach their highest potential. Candace, a single mom, had withdrawn from PIMA in the spring, and then she received the provost's email, and that motivated her to want to come back and re-enroll into PIMA. So she re-enrolled. Unfortunately, she tested positive for COVID. Up to that point, she was a 4.0 student, but it was hard for her to keep up with her work. She was feeling tired, and so she had to withdraw again. But fortunately, thanks to the work of our admissions and recruitment team, who had been in contact with Candace, they got her connected to our enrollment management team, who got her connected with our financial aid team. Candace was eligible for COVID financial relief, complete relief, so that she could return to PIMA. And I just want to share the words of our student affairs advisor, Maria Rodriguez, who reached out to Candace. And she told Candace, I will continue to work with you until we can get you registered again. That's what commitment to student success looks like. But Maria also said something very important, and I quote, "It was a very humbling and eye-opening experience that helped me to connect and understand what our students are experiencing during this pandemic. I'm so pleased to announce that Candace will be taking a writing and economics course this fall." So let me just say this, folks. Together, we are making positive things happen for our students, community, and each other. Keep striving. Thank you, and I look forward to this upcoming year.
Thank you, Chancellor Lambert. You know, uneasy lies the head that wears the crown. With great power comes great responsibility. Shakespeare, Spider-Man, either way you cut it. If you think back to the summer of 2013, we didn't talk like this. Thank you, Chancellor Lambert, for leading us and helping us to be a better Pima Community College. At this time, we're going to introduce a video with award winners.
I'm really appreciative of the honor to be part of the Aspen Fellowship and how I can learn and grow professionally and personally to then bring that back to the college. So I'm very excited. It also provides us an opportunity to have mentorship by a president, either a current president or a retired president, and also to work on a capstone project. As educators, I do feel that we are in a place of privilege, and with that privilege comes great responsibility and power to then create opportunities and break down barriers for our community and for our students, because I know the benefit that education can bring and really uplifting families, not just the individual, but families and entire communities. I think learning from the other fellows as well as the faculty that are involved, the other college presidents that are involved as mentors is something that is very exciting to me. And we, of course, we look at things from our personal lens and from our personal experience, but I welcome and I value the experiences of others and getting to see things from their lens. I would definitely like to thank Dr. Dolores Duran Cerda and Dr. David Doré. They have been very supportive, have been very helpful and encouraging as well. The Chancellor has also been very supportive and always encouraging folks to learn and to grow and to bring that back to the college.
Trying to build bridges between the community and Pima College, and diversity and inclusion just goes hand in hand with trying to make those things happen.
So in our discipline, we have this concept and this kind of mandate of a student's right to their own language. And what that means is that at our best, we champion and we help our students grow with their own language rather than imposing our language on them.
When I say we need to be intentional and strive towards inclusive excellence, I mean that it's a commitment to it, and it's also recognizing that it is perpetual, it's dynamic, right? I am going to be inclusive, and part of doing that is getting to know my audience, which is ever changing.
So I think you've got to be thinking more about that personally, and artists seem to do that naturally.
So it is important for me because I recognize that my students come from different backgrounds. And I also recognize that learning is social and emotional.
I wanted to show the students that, you know, it's not always when you're young and doing, you know, avant-garde art, but it's that vision that you carry on throughout your life.
Online learning isn't distanced from, you know, it's not separate from, you know, justice-based learning. So I think our task is shifting to, okay, well, how do we do this work in an online setting?
I want to give a shout out to the brilliant Kate Schmidt, who is my supervisor and who oversees the Teaching and Learning Center, and my colleague Lisa Schumeyer, who is a faculty fellow with the Teaching and Learning Center.
You know, it's a big honor to even be considered for this award, and I appreciate being nominated for it.
We are ready to go, right? And we have people that aren't afraid to back down, and there is a kind of, you know, a force in numbers that's really invigorating and encouraging.
Congratulations to all of our award winners, Irene, who is also a Spider-Man fan, David, Elliot, and Maze, and of course, Kate and Lisa. And we also want to congratulate all of our colleagues celebrating their years of service. And even though she wasn't in the video, we certainly want to congratulate Chloe Dior, who recently retired after 45 years at the college, which we believe is a record. The full list of employees celebrating a milestone is listed in the electronic program, and be on the lookout for forthcoming announcements regarding our virtual recognition event, which will take place in December. I just want to say, for those of you that have been around a long time, today was a pretty special all-college day. We want to thank our guest speakers who gave us a lot to think and act upon as we prepare to start a new academic year this Wednesday. And I think we have a slide that lists a little more about this afternoon and what comes next. So we'll have a little bit of break for deans and department heads, and then we will continue with Matt Alex at 11:45. There will be a faculty session with our provost at 1. Student services will continue with Matt Alex at 2:15, and at the same time, deans and divisions will be meeting to discuss our years. And then at 3:45, Faculty Senate will start. Thank you to everybody who participated, and again to Christy, PCC TV, events, IT, everyone that made today happen. We wish everyone a safe and healthy year and a happy school year, and we hope to be together soon. And we leave you with a little bit more video. Thank you.
But to die and go we know not where.